This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Welcome back, everyone. I'm Jen Ah, coming to you live once again from the Review-Journal studio. Now, we know there were some delays with the Clark County Commission's emergency meeting on how to deal with spiking COVID cases here in our state, in Nevada, and in Clark County. Their earlier meeting, a special meeting on how the pandemic impacted the economy, ran a little long, and since then they've taken a 15-minute break. Now they've come back to finally start their emergency meeting with the Southern Nevada Health District. Looks like they're just starting right now. Let's take a listen.
It is my meeting. I will not start the meeting until I lay the ground rules. Okay, we will not start the meeting, and we will say security. Okay, this security, we're gonna ask that folks that speak out of turn to be escorted out. So you have that permission to do that. So let's just set the ground rules now. So, lastly, what I want to tell you, this has nothing to do with the school district. The school district rules fall under the State Board of Education and the Clark County School District. So this is just Clark County as a whole, and any school topics are to be heard at the Clark County School Board meetings. So with that, I will speak into the microphone, but Clark County has set a policy for our employees that we all wear masks. So we're within our right to do that. So we'll go ahead and start this meeting. Ms. King, we'll start with you.
Commissioners and Madam Chair, the first item on the agenda is public comment.
Okay, this will be the first time set aside for public comment, and then we'll have a presentation by the Health District, and then we'll have a second public comment. So at this time, I can call by cards, or I can just allow people to line up. So by raise of hands, okay, you guys want to line up? Okay. Okay. Go ahead, ma'am. And if you could just tell me your name so I can find your card and pull the microphone down.
Hello, can you hear me?
I can hear you.
My name is Katrin Ivanov.
If you could state and spell your name so that we can get the record clear.
Katrin, last name Ivano, Frank. Why this start? I haven't finished spelling my name. You already cut 2 minutes out of my time.
Ma'am, go ahead, please.
Okay, first of all, it's disgusting that we've been waiting here since 12 or 1 or 2 o'clock, and you cut in our time. We were told we're going to have 3 minutes to speak. We pay your salary, so this is not your meeting. This is our meeting.
Okay, we will stop the meeting altogether. Please do not clap. Go ahead, ma'am.
Second of all, any decision person takes involve risks. But you are not going to tell us what to do every single time and every single minute in our lives. If I choose to get a vaccine or not to get a vaccine, both involve risks. One, some people die from vaccines, and some people get saved from vaccines. It should be up to us. Same thing about masks. Obviously, you don't know all the science behind the masks, and I was
Okay, ma'am, that completes your time. Go ahead, next speaker, please. Next speaker, please. Next speaker, please. Next speaker, please. Next, security, please remove her from the dais. Okay, next speaker, please. Next speaker, please. You could state and spell your name for the record. Please go ahead, ma'am. Go ahead.
Hi, my name is Dina Valet. We, the people, expect our elected...
Can you spell your name for the record? And the clock does stop every time that I speak.
Since I only have 1 minute, can I put something up here? Because I'm not going to read your oath and waste my time.
Okay, go ahead.
My name is Dina, D-E-A-N-A, Villei, V-I-L-L-E-I. We, the people, expect our elected representatives to uphold their oath to the Nevada Constitution and act in protecting the people's constitutional rights. Failure to act, then, you are acquiescence, knowingly trespassing the people, committing maladministration, and directly trampling the oath you have sworn to the people. As one of the people, I hereby demand that you respond in writing under penalty of perjury within 3 days with certified true copies of all documents as proof of investigation by a qualified authority in point-by-point rebuttal of all statements. A response that provides the constitutional authority granted to you and issue emergency orders that include but are not limited to past, present, and future actions shuttering businesses, requiring masks, requiring vaccination, and/or community lockdowns. A response that provides irrefutable, uncontrovertible proof of the existence of a health emergency. A response that provides your constitutional authority to abrogate the constitutional rights of the people in regard to the issuance of emergency orders. A response showing that the director of DHHS is a medical doctor and has the knowledge and experience and licensure to be practicing medicine in Nevada for infectious disease. A response showing that the people granted DHHS,
Can I get you to spell your last name for the record, please?
HD, CCSD, and the county
Excuse me,
commissioners
ma'am.
the authority to practice
Can you please
medicine
ask
on
her
the
to
community
leave?
at large.
Thank you. So let's just stop right here. Let's just stop right here. Let's just stop right here and hear what I'm saying to you. Hear what I'm saying. I am probably the most respectful person when it comes. Stop. I don't want to hear one word, or we'll just take another recess because I could truly use one. Let's just talk about how we're going to do this. I understand that this is a passionate issue for everybody. Stop talking, please. Okay, this is how it's going to work, and I'm going to only state it one more time, or I'm happy to take a 15-minute recess until everybody can figure it out. I will stay here as long as I need for everybody to speak. First and foremost, when you come to the microphone, please state and spell your name so that I can get it on the record correctly. 2, when I stop you, the clock stops, so you're not being cheated of your minutes. So I'm only going to ask one more time that we do this respectfully. Please, I understand. So no outbursts. I have no problem asking security to just remove you and turn off the microphone, but we'd like to hear your side, so let us do that. So if you could please spell your last name for the record, that would be helpful.
If you could not start the timer until people are done spelling their name, because you have a long name. You have a long name, so someone could spell their name.
Correct. Can you spell your last name for the record?
I lost 20 seconds.
Your last name for the record.
V as in Victor. I-L-L-E-I.
Thank you very much. Would you like to leave that document for us
Yeah,
to
I
read
would.
later?
Thank you so much for your time.
Okay, thank
Have a great
you.
day.
Thank you. Okay, next speaker. I think we have the rules laid out again. So please state and spell your name. Please, for the timekeepers, start the time after their last name is spelt.
Hello, my name is Cody Cunningham, C-O-D-Y-C-U-N-N-I-N-G-H-A-M. And I wish I could see all of your beautiful faces, but I guess I have to carry the team today. Is the board aware that the numbers of Florida and Texas and other places that remove their masks, their cases actually bottom out, and that New York, California, when they added mask mandates, the cases rose because of bacterial cells provide hosts to viruses? I think we've lost a lot of our ability to reason and actually objectively look at data. So really the only thing I've got left is non-compliance. Thank you for your time.
Thank you. Next speaker, please.
Hi guys, thank you for your time. My name is Amanda Knowles, Knowles. I am a pediatric physician assistant in the county. I've born and raised here. I'm also a mother of 3 young children, so my interest is obviously in the protecting of the children. I'm also a registered Republican. I say this because this is not a political issue. I think that there is a reasonable ground, middle ground here that the silent majority can agree on. I would encourage you to look at the new AAP guidelines, American Association of Pediatrics, as far as opening schools and such, and apply those also to just county-wide things that you are considering. Politically, I'm really hesitant as far as like government mandates, but professionally, I think we do have a duty to protect our children who do not have the option to be vaccinated at this point. So with the Delta variant and with the increased cases, I do think that there is a reasonable encouragement of the use of masks. I hate the word mandate. I also think that it is important to note that schools being closed does not hold up in the data. I've seen way too many mental health cases in my practice right now.
Thank you,
because of
Ms.
that.
Mills.
Thank you for your time.
Thank you. Next speaker, please.
Good afternoon, Commissioners. My name is Virginia Valentine, Valentine. I want to thank you all and applaud your Herculean efforts for testing and vaccinations in Clark County. The resort industry from the beginning has made the health and safety of our community, our team members, and our guests our top priority. Partnering with the state, the county, and the Southern Nevada Health District, the resort industry has done everything possible to get team members in the community tested and vaccinated. We offered on-site testing and vaccinations, paid time off, even rewards for employees, and pop-up sites for residents and guests. Vaccination is our best tool for ending the pandemic, and some resorts have achieved greater than 80% vaccination of their workforce. The recommendations from the Southern Nevada Health District are an important reminder that masks after vaccinations are the most effective tool we have for reducing spread and for protecting people who are not vaccinated so they can protect themselves and other people. The resorts have achieved these high vaccination rates with employees, but we support requiring employees who work indoors, vaccinated and unvaccinated, to wear a mask. Whatever you decide today, we ask that you provide written guidance and time to operationalize and communicate new requirements so that we can fully prepare and fully comply.
Thank you. Next speaker, please.
Thank you very much for everything you've done.
Thank you. Next speaker, please.
Jim Blockey, Blockey. And as you can hear, there's a lot of different information out there. Actually, masks are probably work as good as a wiffle ball as a condom. And so it just is, there's all this different information. So I just want to remind you that you people are our elected leaders to serve us, not to tell us what to do. That's not what our founding fathers intended. And you're telling us what to do, wear a mask. That's my decision, not yours. And by wearing a mask, not going to save anybody. It's been proven quite often because I never got it and I never wore a mask. And I hung around a lot of people who had it. So you have a lot of disinformation out there. So just you serve us and we'll do what we need to do. That's what our founding fathers intended for this country. They never wanted us to go through this where you were elected to tell us how to live our lives. That's despicable.
Thank you, sir. Okay, we're not gonna do that. Okay, go ahead, ma'am. Next speaker.
Susan Proffitt, SUSAN PROFFITT. We, the citizens of Clark County, have simply delegated authority to you to make policies, but you failed without any accountability. And we, the people, are back to inform you that you have abused the authority given to you by us, the voters of Clark County. We are here to redress of grievances. We have questions and would like and appreciate an answer, but we anticipate none will come. Why have you allowed the state to close our schools, churches, and businesses and impose restrictions, etc., when you know every place that did lockdowns, imposed masks, and any type of restrictions didn't fare any better than those that did? And in fact, it was way worse in all the blue states who have been a disaster. Why would you repeat the same mistakes all over again? Are you familiar with the breaking news that attorney Tom Renz has filed the paperwork and lawsuit to sue the federal government because they have a whistleblower from inside the government who has signed an affidavit that 45,000 deaths in 3 days were covered up?
Thank you, ma'am. Next speaker, please.
Henry Thorns, Thorns. Man, I guess people don't believe this virus is serious, huh? Because we lost a lot of friends, a lot of associates, a lot of people behind this virus. And to be honest, we couldn't get no face masks, and death was just going big time until my friend Pat Island from Reno sent us some face masks. And actually, it helped the kids. It helped the community. It stopped the spread, if you ask me. You know, I know it's different strokes for different folks, but at the same time, I went and got my shot. I feel better. I was scared to death. And I'm still scared because every time you test my peoples. And we the testers. So, quite naturally, I was scared to death. Now you see how we feel. This is like Monopoly.
Thank you. Next speaker, please.
Thank you, Chair Kirkpatrick and members of the Commission. For the record, David Daslich, D-A-Z-L-I-C-H, Director of Government Affairs for the Vegas Chamber. I'd like to echo the sentiments from my colleague at the Nevada Resort Association. We at the Chamber and many of our member businesses have already returned to masking up our employees, and we would be supportive of a mandate to return to masking employees through the end of August. This is our second most effective tool next to vaccinations, which we and our membership continue to push. We support a mask mandate to help curb transmission rates until we can up our vaccination rates throughout Clark County and finally relegate COVID-19 to the pages of medical history books next to preventable illnesses like smallpox and polio. Thank you.
Thank you. Next speaker, please.
Hi, my name is Lorena Cardenas, and I would like to add to his comment that according to Fauci, the masks are useless, according to his very own emails to his friends. Of course, that's not always
I'm
telling
sorry,
us.
did you say your name for the record?
Lorena Cardenas.
And your last name? Can you spell it for us?
Cardenas, C-A-R-D-E-N-A-S.
Okay, go ahead.
And I know the masks give you a false sense of security, and it also feeds to your fear, which is exactly what's making you sick. The stress is making you sick. But you know, you're not going to force us to mask our kids because it is child abuse. And I already spoke up at the board. I had someone call CPS on me, actually a teacher, and they're investigating her. But this is what happens when we speak up in defense of our kids. You're not going to force us to do something to our children that's going to hurt them. Masks are not healthy. To have our kids with a mask that restricts their oxygen, breathing in their own carbon dioxide, we all know it's a farce. We all know that you guys are going to meet for your coffee and you're going to remove your mask. So it's all a show. We're not buying it anymore. We're just letting you know that this is still America, so we get to decide what's best for our children. You're not going to change that.
Thank you. Next speaker, please.
Tanya Jackson, Jackson. Enough of your hoaxes, enough of your masks, enough of your lockdowns, enough of your fictional case numbers, and enough of your medical tyranny. The game is over.
Thank you. Next speaker, please.
My name is Stephanie Kinsley, last name Kinsley. We have all been dealing with COVID for almost 2 years now. We see that it's not what we thought it was in the beginning. We see the states that haven't locked down are doing fine and thriving. So my question is, why are you guys choosing to ignore science? We just had California won't enforce these mandates because they're silly. Why are you guys choosing? Whose pockets are you in? That you are choosing to sacrifice our children and the citizens that gave you your positions. Please step down from the positions if you're not willing to do as we ask. And my question is, why are you choosing to ignore science? You're choosing to harm our children and put test vaccines into people? You only died from COVID if it was like one of 3 things. Oh, I'm sorry, your heart disease and your morbid obesity also killed you. Why are you ignoring science?
Next speaker, please.
My name is Abby McCoy, ABBY-MCCOY. I appreciate the chance to speak, even though I hate doing this. I appreciate your service, and as you consider further restrictions and mask mandates, I ask that you will please consider representing the people. And as one of the people, they're detrimental to our health, to our mental health, to our economy, to our families, to our children, all of the above. I want to know why we used to count deaths and now we count cases. As viruses and sicknesses evolve, the contagiousness rises and the seriousness and deadliness often declines. And so I want to know why we are counting cases and not deaths. I want to know why we're all getting in cars when those are so dangerous, way more deadly than this virus. It has a 99% chance of survival. The Southern Nevada Health District is not doing us any favors. They are miscommunicating and counting our children as high-risk factors, and they're not. The only children that died, according to Johns Hopkins University, 325 of them all had
Thank you. Next speaker,
serious
please.
conditions.
Next
Caroline
speaker.
St. John, STJOHN. This country was formed based on Judeo-Christian values. Our Constitution protects those values and also protects our rights. It is the supreme law of the land, and none of your directives or laws are above it. Therefore, masking the public is illegal. It is also unhealthy and factually does not work. Vice President Kamala Harris says to get the jab because the Bible says so. God is calling us to awaken to the truth, not to listen to evil agendas from principalities that wish to control us. This is not red versus blue. It is good versus evil with evil players on both sides. Are any of you aware of the numbers of adverse effects and deaths caused by experimental vaccines? 45,000 dead from vaccination in 3 days. Lawyer Thomas Rentz sues the federal government. Do any of you know who Kerry B. Mullis is? He's the inventor of the PCR test, which he says cannot detect infectious disease such as COVID. Yet you use it to scare the public anyhow. Long-term mask use breeds microbes that infiltrate the lungs
speaker,
and contribute
please.
to
Go ahead, sir. Next speaker, please. Next speaker, please.
My name is Travis Ebarb, Travis-Ebarb. I come to you guys as a concerned constituent that the fact that we are coming to another possible decision to repeat the insanity that we went through the first time. So what's the definition of insanity? Expecting different results, doing the same thing over and over. So if you guys really cared about the constituents, wouldn't we provide proper medicine? Obviously the vaccines aren't working. If you guys haven't seen that data, I suggest checking it out. But there are people fighting for the people, and I'm asking you guys to fight for the people. Mandating a mask issue is not going to do anything. We're going to do this over and over and over. I would appreciate you guys very much if you can consider that. Thank you.
Thank you. Next speaker, please.
Judy Leslie, Leslie. There is no more pandemic. It's done. It's gone. There is no state of emergency. It's done. Our governor, he was one of 32 governors summoned to the Pentagon, and out of those governors, they were told they were all stripped of their duties. So I'm saying, are you now his lackey who's going to go and mandate us? I don't do mandates. They're not law. Nobody can tell me that I cannot breathe fresh air. Not you, not God, no, nobody, and especially not our governor. So I'm just here to say there is no emergency. Sorry.
Thank you. Next speaker, please.
Start my time. I don't have the right time. This is John Carlo, John-Carlo. I am the vision of my fathers. I am the hope of the future. I am the strength in the moment. I am the ghost patriot. I come to this assembly to peacefully protest in the name of the great governor of the universe and Jesus Christ. I'm here to talk to the so-called county commissioners that were falsely elected into office. I am here to tell you that if you do pass these mandates, unconstitutional mandates, we will flee from Clark County. We will go to other counties that are better counties than Clark County, even if we have to be poor and give up our riches the way our patriot forefathers had. These are your bosses behind me. We pay your tax dollars, and we will declare our independence. I have the Declaration of Independence.
Thank you. Next speaker, please. Next speaker, ma'am. Go ahead.
Wait for me. Back up.
Hi, my name is Teresa Hall, Hall, and I would just like to point out to begin, is that people begging you for money that isn't yours got 6 minutes, and we're limited down to 1. So that's the first problem with this state right here. Second is, while you guys are bringing up hospitalizations, I'd like you to know the real number of these hospitalizations, because they hospitalized me for a sore throat. I told them I didn't have any problems. All I needed was a Z-Pack. They still hospitalized me. They told me they were going to check my BP before they took me upstairs, before they admitted me. You know when they checked my BP? After they took me upstairs and after they admitted me. When they had me stand up, my BP was fine. Then they made me lay down. That's when my BP went back down. That is called actual medical hostage. They held me medical hostage and I had to demand to be let go. And people are afraid to demand to be let go because if they do that, then it's against medical advice and their insurance may not pay. That is a real issue. So how many of these hospitalizations are really hospitalizations, and how many of these people could have been let go days, if not some of them weeks before?
Thank you. Next speaker, please.
I placed something here for you guys to read for yourselves.
Okay, so put it on the center. Okay.
My name is Hilda Guerrero, Hilda. Guerrero's Guerrero. And I just wanted to remind you guys that we are in America. And I'm going to read some stuff to you guys. It is impossible to rightly govern a nation without God and the Bible. George Washington. There is none justification for taking away individuals' freedom in the guise of public safety. Thomas Jefferson. That government is best which governs at least because its people discipline themselves. Thomas Jefferson. A democracy is nothing more than a mob rule where 50% of the people may take away the rights of the other 49. Thomas Jefferson. The two enemies of the people are criminals and government. So let us tie the second down with the chains of the Constitution so that the second will not become the legalized version of the first.
Thank you. Next speaker,
Christine
please.
Borrello, Barrello.
I'm sorry, can you state that again for me?
Christine Borrello, Barrello.
Okay.
The masks are just a Band-Aid to the problem. The cure is medicine and supplements and healthy eating and taking care of each other. And no one is taking care of us. You guys are representing us. We asking you, please, stop lying to everybody. Help us. Everyone's afraid. You don't go in a garage and let your car run with the doors closed. It's dangerous. And so are the masks. Please take them off our children.
Next speaker, please.
Michelle Whaley, Michelle Whaley. Everyone's coming up here and they want to discuss whether masks work, whether they don't, social distancing, the science, so on and so forth. I understand the science quite well. I'm a registered nurse. I cared for COVID patients almost every single day, maybe getting one day off every 3 weeks. From March through August last year, I had COVID myself. That's when I finally got time off in August, is because I got COVID. I know all about COVID. But what we're here for, hang on. What we're here for is to remind you that the government was created by the people to protect our rights. And our rights include life, liberty, and pursuit of happiness. That includes being able to have our small businesses, being able to move about freely without your mandates and what you think is best for us. You cannot hinder the movement of a free people, and we are still a free people. Thank you.
Thank you. Next speaker, please.
My name is Alex Rodriguez, AlexRodriguez. I work at a pizza place. Most of our staff is not vaccinated. Not that it is any of your business. We stopped wearing masks as soon as this mandate was lifted. We can't question by if any law our customers or third-party delivery drivers who come in and out of our store is vaccinated, and we don't care. Out of thousands of customers and third-party delivery drivers that walk in our store, we have not had one complaint about anyone getting sick or dying from COVID. I am roommates with my sister who works at a grocery store. She's around thousands of people a day. She comes near me. She comes near our 60-year-old mom, our friends, our relatives. Nobody gets sick. I hang out at a local bar. We're attending sporting events, concerts. Nobody is scared. Majority is not wearing masks. I still haven't gotten one answer from the beginning of the lockdown. Why was it safe to go shopping at a Walmart with thousands of foot traffic, but it's not safe to go shopping at a small, non-essential comic book store that gets a few people per hour? According to the CDC, more people die from cigarettes a year than this virus. Maybe we should focus on banning cigarettes than making us wear.
Next speaker, please.
Hi there. I'm Natalie Rita,
Please do not clap
NATA.
out loud or I will stop the meeting. You decide. Go ahead,
Natalie
ma'am.
Rita, NATALIE, REDA. Born and raised in Vegas. I don't know about you, but I love our town. I think it's pretty rad. I love the locals. And just to mention, yeah, life is delicate. It's sad that we all die. It's sad. I was 9 months pregnant, and my own daughter died from blood clot. Found out I had a blood clotting disorder. Definitely can't take the vaccine. Speaking of the vaccine, my dad took the vaccine, and now he has COVID. That was months ago that he took the vaccine. That's irrelevant. But my point is, life is short, and I think it's very important that we see each other's faces. I'm a teacher. I've been teaching 15 years. My students need to see my face. I need to see their face. I'll be at the meeting to tell the district that. Don't worry. But how am I supposed to know how Johnny's doing? If something happens to Johnny and he takes his life, were there any signs? Well, I don't know. I couldn't see his face. He was blinking, maybe weird. My point is, again, life is special. 3 times I said that, but we need to see each other's face. There's some type of interaction that goes with it that is, I don't know. There's some science we don't understand to it, but we exchange energy when we see each other's faces, when we interact. And Old Vegas, my whole family's in gaming. Old Vegas, we'd want to see each other's faces.
Thank you. Next speaker, please. No clapping, or I will stop the meeting. Next speaker, please.
Before I start, can I ask a question? Can I admit evidence?
You can put evidence up there, and then our clerk can take it, and we can include it in the minutes.
Because I just, have some evidence I'd like to,
Okay. Absolutely, go ahead. But please state and spell your name for the record first.
David Cochran, Cochran. First of all, let's talk about science. Do you all agree in the line spoken by virtually all the elected and non-elected leaders around this country? Trust the science? Yes, trust the science. How do you create such a thing as science to trust? Science is created and written by man. In order to trust science, it must be scrutinized to be given validity. Without strict scrutinization from all directions, then science just becomes opinion. By limiting the amount of voices, silencing people on certain topics, man can then manipulate the science. Science, as it pertains to COVID-19, let's talk about treatments. I'm not a doctor, I don't claim to be, but I can share with you many case studies done by doctors on a drug called ivermectin, as reported by Frontline COVID-19 Critical Care FLCCC Alliance, of which I would like to present to you as evidence. Let's talk about numbers.
Okay, sir, next speaker, but you can leave the evidence, and our secretary will take it for you. Thank you very much. Next speaker, please.
My name is Nathan Rodell, ROODELL. I'm also speaking on behalf of Andrea Dietrich, who's watching on Zoom. I was on the CDC.gov website today. I find it funny that they have all the confirmed cases, all the deaths. The only category left blank is recovered. So let me give you those numbers. Clark County, as of 12:07 today, 270,421 confirmed cases. 265,855 recovered. That's a 98.4% recovery. Of the new cases, 1907, 3 of them have become deaths. That's 0.1%. Your political theater must stop. Masks don't work. We have the right to breathe freely, and no mandate can declare that we have to listen to what you're saying. Bacterial pneumonia, #1 killer during the 1917 Spanish flu. So that was caused by wearing dirty masks.
Thank you, Nick.
Non-compliance will become the new normal if you all continue this
Thank
theater.
you. Thank you. Next speaker, please.
My name is Jennifer Bailey, JENNIFERBAILEY. There has been zero scientific evidence provided to the public to show just cause for these tyrannical mandates. Where is their data? Nothing. The politicians kept changing their mandate rules and also breaking them. This pandemic is nothing but a BS smokescreen. The masks don't work. The closures did not work. What scientific, logical, and factual justification do you have to implement these restrictions again? You don't. Facts are suicides went up, abuse went up, mental illness and drug addiction increased. Where is that hidden data? Where is their help? How in good conscience can you blatantly lie, state you are for the people when your actions clearly show you're only self-serving out for your own gain? Oh, right, you cowardly hide behind those masks. Pharmaceuticals that are now being proven to be effective were slandered months ago and deliberately restricted, directly correlating unnecessary deaths. Also curious who benefited from the COVID relief fund. It wasn't the public. I would like to know if any of you have a pair, because the one person I constantly see fighting for the people is Joey Gilbert without fear. Where are your cojones? Are any of you actually willing to do the constitutional thing, the right thing, fight for the people who elected you, who trusted you?
Thank you. Next speaker, please.
Teresa Moorhead, THERESA, Moorhead, MOORHEAD. I'm here to talk about, I view this problem as a biologic cyber war investigated by a large group of eugenists involved in massive depopulation agenda. Now, you can actually look up anybody's name who had the vaccine and go on the website, and you can see their name, what they're doing, if they're sleeping, where they're located in the world. Isn't that wonderful? And then also, this is a sophisticated tracking system. Also, it's loaded with graphene oxide and baby fetus tissue. And there are businesses that won't allow people that had vaccines in there because of the fact of the protein spikes that you have to be aware of. People having shedding from the people that have been vaccinated. There are also people that the airline pilots, they're not allowing the people that they've mandated to have vaccines, that the airline pilots are dropping and dying like crazy. And what's happened is the insurance companies will no longer insure them.
Thank
Is that
you.
my time up?
Yep. Thank you. Next speaker, please.
Jennifer Phillips, JENNIFERPHILLIPS. Not a single healthy child has died
since COVID has been introduced into this world. We know that underlying conditions and obesity combined with COVID, which is a flu virus, has killed. Let's think about this as a flu virus. It changes all the time. So what is this vaccine going to do to really help? Is actually doing more harm than it is helping. And closures are doing more harm than they are helping. That's been proven. It hurts mental health. It kills businesses. It makes only the ones that are corporate survive. My parents actually got COVID, and the doctor told them there's no point in you getting the vaccine because your antibodies are a natural immunity and will help you, and better than this vaccine will. We need to leave it up to us to decide our health. We don't need you to decide for us. It is our decision.
Thank you. Next speaker, please.
Ben Cusio, C-U-C-I-O. I'm actually here addressing Commissioner Jones, Commissioner Naff, and Commissioner McGurty II. As a small business owner, I rely on your districts to make me successful and to take care of my wife and 2 children. The room is filled with emotion and passion right now, so I thought I'd try a different tact. Inflation is going to settle in, and is settling in, and is not going to go away. You know, after listening to all the presentations, the foundation for the request for funds is based on COVID-19. So of course I understand now that they don't want it to go away and they want another closure. But the people are not going to make any money and are not going to make any semblance of a reality having to face another, shutdown. So I'm pleading to the 3 most prominent district commissioners to avoid another closure because, my business survived, but barely. And the Paycheck Protection Program is a joke. We need your help.
Thank you, sir. Could I get you to state and spell your name again for me?
Yes. Ben Cusio, C-U-C-I-O.
Okay, thank you. Next speaker, please.
Good afternoon, everybody. My name is Blake Coral Bayetti, C-O-R-L-B as in boy, A-I-E-T-T-I. I have a master's in kinesiology. I serve in the U.S. Army in physical therapy, and I'm currently pursuing medical school here in Nevada. I moved back here because I love this city dearly, and it's always been good to me and my father. And I want to come back here and make an impact, and I felt today to be one of the most ample opportunities to do so. This is cringy but true, but if you do what you've always done, you're going to get what you've always had. There's nothing close to the empirical scientific consensus based on the literature review that I've done, which includes 45 plus published papers on COVID. The mandated lockdowns and mandates have yet to come to anything close to an irrefutable scientific evidence that suggests that they have been effective. What has been done up to this point does not work. Furthermore, it has not been objectively established at what rate of infection justifies a lockdown to begin with. If we're truly going to be driven by science here, let's have honest conversations about what we're measuring and the outcomes of interest and be objective about the data that we're interpreting. The data will always be the data. It's not subject to opinion.
Thank you. Next speaker, please.
Yes, my name is Pam Norman.
I'm sorry, ma'am. Could you speak a little closer into the microphone and state and spell your name for the record?
My name is Pam Norman, P-A-M-N-O-R-M-A-N. I'm here today to speak on behalf of my 15-year-old daughter. I would like her to go back to school, no mask, and I want all the teachers or the staff there to, if she doesn't wear a mask, to not bully her into wearing one. Same thing with the students. We are not asking the students to not wear their mask. And there are teachers here actually would like to be in class without a mask, with the students without a mask. I think that if they want to do that, they should hold a session, and the kids who are not able or don't want to be in there without a mask can stay home and do online distant learning instead. And I think children need to have free, clean oxygen in order to excel in their learning. Thank you.
Okay, thank you. Next speaker, please.
Hi, Monica Ursula, M-O-N-I-C-A-U-R-S-U-A.
I'm sorry, could you say it again?
I'm sorry?
Go ahead, can you say it again? You said it quick. I was trying to...
Monica Ursula, U-R-S-U-A. I asked this county commission, why are we even having this meeting? Because of a small spike? Let's throw out all the greater good because you all think you can migrate a virus. The past year and 4 months has shown us that you cannot. Today, you are meeting for yet another mask mandate, and it will fail to be enforced. Our police officers just won't enforce it. It's just they have too much else to do. This mandate is a failure to begin with. We, the people, say no more. Vegas is starting to come back. My family is starting to go back to work. My fear is that this will again lead to lockdowns, business closures, or failures. If you choose to continue with these mandates, they will be remembered at the ballot box. Thank you.
Thank you. Next speaker, please.
My name is Mary Tortomasi, Tortomasi. I'm born and raised in Las Vegas. My parents were here for over 50 years. I would not want to be sitting in your seats. I want to thank you for your job, but I also want you to use critical thinking in making this very difficult decision. I agree with everybody that's been speaking. Even the ones that agree with the mask, I have a feeling that they just haven't really maybe searched some of the information that's out there because it is being suppressed, clearly. I pray for your critical thinking. I also pray for you and your families and all of ours as we move forward. Thank you very much.
Thank you. Next speaker, please.
I have a request before I speak.
I'm sorry?
I have a request before I speak.
Okay, go ahead.
Could everyone put their phones down?
Can I go ahead and get you stop, don't stop, or we'll take a break. So go ahead. So if you could go ahead and state and spell your name for the record, that would be great.
Emily Palmer, Palmer. I was a proud owner of La Petite Cafe and Bakery a year ago, and you guys ripped that away from me. 4 years of my blood, sweat, and tears ripped from me. I could not provide for my family. I got locked out illegally. No one helped me. I had to sell my whole cafe for $5,000. I am financially ruined. And then you made my son stay home, depressed, barely getting by. Shame, you guys, come on. I'm asking you, please. Let us live, making a choice, please. I can't do this another year. I'm begging you. Please. That's all I have. I got nothing else. I'm ruined. You took it all from me. For what? The PP loan didn't even come on time. Now I'm in debt 100K. Plus, I'm in debt 200K. How much more? I've lost everything.
Thank you. Next speaker, please. Stop with the clapping. Next speaker, please.
My name is Lucille Petrosky, Petroskey, and I'm here on behalf of my 12 great-grandchildren who are struggling with getting back to school and mask mandates and potential vaccine mandates. And myself, at my age, I cannot wear a mask for very long without feeling the oxygen being deprived from me. I have to literally take it off and take some breaths. So I can imagine it has to be detrimental to children. We need oxygen. That's what we breathe. I think it was determined that CO2 was a poison, and so we're literally poisoning ourselves and our children and grandchildren. And I hope that you'll take this into consideration. Thank you.
Thank you.
Hello.
Next speaker, please.
Hi, my name's Susan Boop. It's B as in boy, O-O-P as in Paul. We put a price tag on our lives every day. Why is COVID shutting us down? Life is full of risks. When we get in a plane, when we get on a plane, when we get in a car, the variety of sports that we participate in, the list goes on. Behavior has risks. We don't stop people from risk because we are a free people. Why are we masking people up when masks have been proven to not stop a virus? Children have a zero morbidity when they have nothing pre-existing like a cancer or other life-threatening disease. Children are easily treated and survive. With a 0.5% death rate, you have a higher chance of being attacked and killed by a tiger. My question to you all is, why are you even considering another lockdown for your fellow humans?
It's not just you. Children are literally killing them.
Next speaker, please.
Hello, my name is Michelle Nielsen, Michellenielson. I am the mother of 6 beautiful children. I came with a speech, and I have one thing to say. You were voted in by us, and I want to implore you to give us the choice to decide what we would like for our own families and for our own lives. It is not up to you to dictate whether we wear a mask or whether we get vaccinated, okay? If we want to take on the responsibility and possibly die of COVID, that's my choice. That's my choice. It's not up to you. And I realize that you guys all think that we're a bunch of nutballs, that we're crazy. But guess what? You need to look into our eyes and see our grandeur, okay? We are brothers and sisters here, okay? We live in America, and it is your job to work for us and to listen to us. I have faith in you. I know you will make the right choice. Please listen to us. I appreciate all you do, and I appreciate your time.
Thank you. Next speaker.
My name is Holly Stevenson, STEVNSON, and I came down here with my kids because I feel like this is important, and they are watching you guys too. But I just wanted to get up here and talk about just our freedom. Same with the gal I was talking before. We should have that choice. If we want to put ourselves in that situation, my whole family had COVID. My kids were barely touched. They are fine. They have antibodies. They should be fine. My daughter is almost in tears thinking that she might have to go back to school and put a mask on. And I just ask you guys to think about that. Think about the science about the kids. Think about, and I know I'm going to be at the school board meeting too, but just remember last year about how high our suicide rates went in our Clark County. It was unthinkable. It was terrible. And these things are affecting our kids. They're affecting us. We had 2 businesses go under, and it's devastating. And we're finally starting to build it up again. And if we get shut down, it will devastate us again. So I'm asking you, please, I thank you for your help. I know you guys are concerned. Thank you.
Thank you. Next speaker, please.
My name is Alicia Shafter, ALICIA, I will probably just remind you of the things everybody else has reminded you of and that you know, but it's important to have unity and strength in numbers. Viruses, if you guys are concerned about the Delta variant, then you guys should know that viruses always mutate to weaker and less lethal. There has, in the history of virology, there has never ever been a viral mutation that resulted in a virus that was more lethal. As viruses mutate, they become more contagious and more transmittable, but they become less lethal. I'm sure you guys are all aware of that if you guys have done a little bit of research on this Delta variant that has magically appeared. I want to remind you guys about the ineffectiveness of masks and the detrimental use of them. I have a cousin that has 2 deaf children. One of them is 8 years old and the other one is 2 years old. They have not been able to communicate with people. They should not have to have an exception because they are humans just like us. They need to communicate with people. They haven't been able to see anybody's faces.
Thank you. Next speaker, please.
My name is Beverly Stevermer, Beverly, Stevermer. I am a mom. My daughter and son-in-law easily recover from COVID through the grace of God and their very own immune system. Some haven't been as fortunate, and rather than give them the medications needed to recover, our tax dollars are being spent to coerce residents to take injections that for many like me is not in the best interest of their health. I am also a grandmother. My grandchildren have not and will not kill me. They need me and I need them. They also need to learn and walk free without being suffocated by adults. The forced masking of our children is unhealthy for them mentally and physically, and in some counties it is criminal. My husband always says that the measure of honor of good men is best judged face to face. You, the Clark County Board of Commissioners, hide behind your masks like cowards and dishonor our community.
Thank you. Next speaker, please.
Hi, my name is Roseanne Palazzolo, Roseann Pallazzolo. There is zero science that show masks protect anyone from COVID. Dr. Fauci's leaked emails show that, and he admitted it. Masks and shutdowns do not work. A lab in Florida analyzed a small sample of protective masks, detected 11 dangerous pathogens on the coverings, including bacteria that cause pneumonia and meningitis. Can you imagine all the bacteria and dangerous pathogens on the mask you have on your face right now? What it's doing to your long-term health and body? Where's the science in that? That should be followed. Clark County had the highest suicide rate in children in the U.S. during the pandemic. Population of Florida, 21.5 million. No strict lockdowns and no mask policy. Population of New York, 19.5. Strict COVID restrictions. New York, 54,000 deaths. Florida, 38,000 deaths. Total COVID infections in Florida, 2.4. In New York, 2.2. Lockdowns don't stop the spread. Look at the data and the facts. Shutting down our city did not stop the spread. Increased domestic violence, increased drug addiction, increased suicide, alcohol abuse, child abuse. Did you hear about that woman who lost her business? She's not a government paid employee like all of you.
Thank you. Next speaker, please.
My name is Jenna Gifford, Jenagifford, and this honestly is the first one of these meetings that I've ever been to, and I will never come again. This is the joke. And I think it's incredibly rude. This meeting was supposed to start at 1 o'clock, and I was here on time early, and you guys couldn't start on time. And so as I'm sitting here, and I was here the whole meeting, all I could think was, you can't even manage a meeting properly. Why should you be allowed to make decisions that impact me? And I know this is a complicated
no clapping,
issue, but
ahead.
people should be allowed to make their own decisions. You have no right to make decisions that impact me negatively like that. And so that's all I'm here to say, is that I oppose any mandates that you would make. And as I came to this meeting, it really became apparent that you don't make the right decisions, that you don't manage things appropriately, and that you shouldn't be allowed to make decisions that impact me like that.
Thank you. Next speaker, please.
All right. My name is Cami Plum. That's CAMIPLUMB. This is also my first meeting. It's been a very enlightening 3 hours. I just wanted to say that I oppose a mask mandate. I recognize that this is complicated. I believe that people should be allowed to make their own risk assessment and decide whether it's a good choice for them or a bad choice for them based upon their health, whether or not to wear a mask, and that people in general make good choices for themselves and need to have that freedom to be allowed to do so. Thank you.
Thank you. Next speaker, please.
Hi, my name is Natalie, Natalie, last name Maria, Maria. I was not planning on speaking here today. Thank you for everybody that did speak. You said more than I can offer. I can tell the commissioners my story or observations, but I'm pretty sure that the fact that we're even here today, all of you have your minds made up as to what you're going to do. Because of that, I choose to address the people rather than the commissioners. Nobody is coming to save you. Find your personal power and use it. Do not comply, and do not allow your children to comply. It's that simple. This madness ends when we say it does. Thank you.
Thank you. Next speaker, please.
Hi. Good afternoon, ladies and gentlemen. My name is Frances Dean. You probably recognize me. The thing is, guys, is I've sat here for almost 4 hours today.
Ma'am, can I get you to please spell your name for the record?
F-R-A, whoops.
Your first and last.
Frances, Dean, D-E-A-N-E.
Okay,
Been here for several hours today, ladies and gentlemen, and I've seen people ask you please, like they're begging you. We had a lady up here sobbing. The best you could come up with was thank you. Not I'm sorry, nothing. You said thank you. That doesn't resonate empathy on any level. I'm embarrassed for you that every one of you is a Democrat. There has been 3 people come to support the Democrat position of wearing masks and shutting us down. Now, I'm not saying that everyone behind me is a Republican. Probably they're just pissed. I'm suggesting that you, each one of you, who couldn't even bring your supporters to the table to step up and support masks, to listen to what these people are saying and never again pick up your cell phone while people in the public are talking to you. How rude. Learn a lesson. You want us to behave civilly and not clap?
Thank you. Next speaker, please. Go ahead, ma'am.
Anna Binder, B-I-N-D-E-R.
Go ahead, ma'am.
They're talking back there and it's distracting. Some people know me. I've tried my best over the last 15, 16 months to be the loudest voice in our community to keep our children in school or get them back. And we have school starting 3 weeks from now, and everything that has happened in this room just now has been an example of exactly why you guys are sitting here right now in this emergency meeting. There's obviously people in our community that cannot prioritize the importance of our children's mental health and well-being and getting back to school full-time. I am literally sitting here in tears because I cannot believe that people will not prioritize our children. Obviously, I deal with the CCSD board, but what happens here today with this vote gives them, I believe, strength into the decision that they're going to be making in our reopening plan to keep our students, staff, and teachers safe so our children can get back. Thank you.
Thank you. Next speaker, please.
Madam Chairman, County Commissioners, Daniel Brasted, D-A-N-I-E-L, B as in Bravo, 7, B-R-A-I-S-T-E-D. I just walked to the cafeteria, and there was a sign on the door with the suggestions on how to protect yourself from the COVID. And it was 6 feet, it was wash your hands and a couple others. Not one time, not one paragraph do you ever hear out of government telling you to eat well. It's your immune system. You need humor, sleep, oxygen, chlorophyll, those basic things. At least put it on the sign so that your citizens could say, well, that is drunk, that's stupid, I don't like that. But at least tell your citizens that there's other options. Do you have any naturopaths on your consulting for health? They're advocating a different situation. So allow us to decide whether we want to wear a mask. And if a business wants to post only masks, I'll respect that. But allow us to decide if we want to breathe oxygen. Thank you.
Thank you. Next speaker, please.
Heidi Karchner, K-A-R-T-C-H-N-E-R. And I echo what that gentleman said. I would just appreciate, as a citizen born and raised here in Las Vegas, and I just implore you to listen as we share other ideas. I love what he said about our immune system. We were all given an immune system, and ways that as a community, as our leaders, to help us as the citizens would be to help give us and educate us, which would be in vitamin D, getting outside in the sun, eating correctly. I just think there's a lot of other things we can do besides masking. We tried it didn't work. Let's try something else. Let's give the people their freedom. Let us make the decisions for ourselves. And that's all I have to say. Thank you.
Thank you. At this time, I'm going to ask if there's anybody who has not spoken that would like to speak during public comment to please come forward. State and spell your name for the record.
Thank you. My name's Dave Crete. Last name is C-R-E-T-E. I'm a small business owner in Las Vegas. I'm a person who spent 42 days bedridden with COVID last year. I'm also a person whose business was devastated by all of the restrictions. I've also had the immunization. I had that because that was my personal choice. We have been given in this country the freedom of choice, which also means that freedom brings us the responsibility to be accountable for those choices. But that said, the doctors told me I had immunizations because I was sick for so long. And I will tell you, I never imagined I could ever possibly be so sick. But I also read things that said it might be a good idea because the time that the immunity will last in the human body was unknown. So I didn't want to risk it. But that was my choice. Another shutdown, my business may not make it.
Thank you, sir. Anyone else that has not already like to speak at this time, please come forward and state and spell your name for the record.
I missed all of this because I was in another meeting. Sorry, I was so negligent.
Mr. Euling, please state and spell your name for the record.
My name is Ed Euling, U-E-H-L-I-N-G. I apologize for not attending the rest of the meeting or the earlier part. Anyway, one of the things I'm really concerned about is the data that we're being given on the public information on the news. It never mentions how viruses are fought against, and that is by antibodies that we develop just by our natural being, by our immune system. That is never taken into account. It's as if first of all, our genes of every person in this room have overcome probably 100 or 1,000 pandemics in the history of humanity, and in order to be here. And so we should use that, not depend on artificial means.
Thank you, Mr. Euling. Anybody else who has not spoke during public comment already wishing to speak, please come forward and state and spell your name for the record. Seeing none, we're going to go ahead and close the public comment period, and I'll turn it over to Ms. King.
Commissioners, item number 2 on the agenda is the approval of the agenda.
Okay, I have a motion by Commissioner Gibson to approve the agenda. Any discussion? Seeing none, please cast your vote.
Aye.
Let's do this. There's some technical. So all those in favor, please say aye. Opposed? And that motion carries.
Could someone from I think he's coming up.
Sorry, Commissioner Naft? Oh, we're good? Okay. For the clerk, did you get that? Okay. Okay. Ms. King.
Item number 3 is to discuss the increasing positivity rates of COVID-19 in Clark County and the recent recommendations from the Southern Nevada Health District, and take possible action in implementing measures to mitigate the infection rate.
Okay, at this time, I'd like to invite Dr. Lockdown from the Southern Nevada Health District.
Good afternoon, everybody. My name is Dr. Court Loaf. I'm the Chief Medical Officer at the Southern Nevada Health District.
Mr. Loaf, can I get you to use the handheld microphone? It
Sure,
might be
of
helpful for you.
Is this better? Much better. Awesome. Great. Thank you. Yeah, my name is Dr. Court Loaf. It's C-O-R-T, last name L-O-H-F-F, and I'm the Chief Medical Officer at the Southern Nevada Health District. I just want to make a few points about what we're seeing here in Southern Nevada related to the COVID pandemic. Since early June, when we saw a lull in activity here in Southern Nevada, we've seen an almost tripling of COVID-19 cases in our community, and almost tripling as well of the positivity rate, which is the percent of tests that are COVID positive. This is largely being driven by the Delta variant, which you have seen on the news is a much more contagious type of the COVID-19 virus than we were used to previously. So that Delta virus is accounting for the vast majority of cases here in Clark County. In addition to that, we're seeing a plateauing in our vaccination rates, which is, again, driving the increase in cases here as well.
Okay, so Dr. Loaf, at this time, I guess we can open it up to questions, and I would just ask the audience to please refrain from speaking out because it does mess up the record. So maybe, Dr. Loaf, I can have you talk about the press release you did with the specific recommendations that came from the health district. Maybe, what day is today? Tuesday, maybe late last week?
Right. So on Friday, the health district issued recommendations for the public to wear masks in public settings regardless of their vaccination status. We did so because we recognize that masks are an effective tool for not only preventing infection with the virus, but also transmitting the virus onto other people. So that's why we came up with that recommendation. It applies only to public spaces where there's an increased likelihood of transmission of the virus.
And so that specifically was a recommendation for those public spaces. There were some locations specific in the press release. I'm trying to remember what they all were.
Yeah, any public space, large gathering, which would include stores, malls, sporting events, obviously large gatherings, concerts, things like that.
Okay. Commissioners, I know we're accustomed to having Dr. Lagon here. Commissioner Sagerbloom and I sit on the health district, so if you have any questions, probably could start now. Commissioner Jones, Naft? Commissioner McCurdy? Someone? Anybody? Not everybody has to ask questions, so. Somebody
Thank
go.
you, Dr. Love, for being here and filling in for Dr. again. Can you speak to, so the recommendation was for all people in indoor spaces to wear masks, not just employees, right?
That's correct.
Okay. And were there any recommendations with regards to where we need to be in terms of vaccinations? I know you talked about plateaus. Look like we're about 4,000 per day right now. Is there any recommendations for what we should be doing more in order to increase our vaccination rate?
Yeah, so certainly our primary goal right now in the health district and working with our community partners is to increase our vaccination rates, because vaccine is the most effective tool of preventing the COVID transmission. Unfortunately, we hit a lull in that activity, but we are working very aggressively to identify hotspots in southern Nevada, and doing some targeted efforts to try to make vaccine accessible and available to those areas.
Can you speak to, in terms of vaccine resistance, what populations are you seeing the most vaccine resistance or failure to get vaccinated?
I'm sorry, can you repeat that, please?
Sure. In terms of populations that have not gotten vaccinated, I know we've heard that the elderly have gotten vaccinated at very high rates. Who is it that still needs to get vaccinated?
Yeah, certainly our biggest pockets of unvaccinated are younger folks, 12 and older, who are eligible for the vaccine. We're also seeing low rates among African American folks.
And what efforts is the health district taking in order to get those populations vaccinated?
Yeah, so we're doing some targeted efforts in several zip codes in the southern Nevada, where we've seen both high rates of COVID activity as well as low vaccination rates. And when I say targeted efforts, I mean making vaccine accessible in those areas by actually setting up clinics in those zip codes, making vaccine available for folks in those areas. We're also doing some very aggressive marketing efforts, as well as some social media campaigning as well, to try to encourage and promote vaccination, and in doing so in such a way that we feel that the younger population especially would be more likely to take that messaging, if you will.
Is it the health districts themselves that is doing the outreach campaign to younger folks, or you have a contract with somebody else, or how does that work?
Yeah, so the health district is obviously very involved with this effort, but there's lots of community partners both at the local level and the state level that are working very aggressively to try to promote vaccinations as well as make vaccine available.
Okay, can you walk through sort of the social media platforms that the health district and its partners are using right now?
I can't speak to all the details, but one of the things that we're working on is we understand that young folks are very apt to use social media to get information and to do things. So we're working on some social media campaigns, including working with some social media influencers to try to get information out to that target population.
Okay. But again, I know you're not, maybe not all of it. Like, for me, Facebook is cool because I'm in my 40s, but for my 16-year-old daughter or my 20-something folks who work for me, they don't use that because it's for dinosaurs. So,
what are you trying to say, Commissioner?
When you say social media, it doesn't necessarily get at the population who we're trying to target. And are we using things like peer-to-peer networks, DMs, et cetera, in order to get at these folks?
Again, I don't understand the details of our campaign. I can certainly work with our public information office and get those details back to you tomorrow if you like.
Okay, that'd be great. And in terms of the sort of the targeted goals from your website, the population threshold, which I assume means herd immunity, right? Is that what the 70% population threshold for vaccination refers to?
Yeah, that was a threshold that initially the state had set for the so-called herd immunity. Of course, we were not able to get to that level. That is something that we do aspire to and something we're continuing to work to, but we recognize that we have a long way to go to get to that level.
Okay. Because on your website, it says about 160,000 vaccinations that are still needed to reach that level. And if we're at 4,000 a day, we're still looking at about 40 days if we just maintain the 4,000 a day.
I'm sorry, can you repeat that, please?
So according to your website, it's about 160,000 vaccines that we still need in order to hit the 70% population threshold. Our current level of vaccination is around 4,000 per day. So according to my math, that's another 40 days before we hypothetically reach that 70% goal.
That's correct, yes.
Okay. Okay, thanks.
Commissioner Neff.
Thank you, Madam Chair.
Excuse me, sir. Stop. Excuse me, sir. We're going to move you if you don't stop. Commissioner Neff, go ahead.
Thank you, Madam Chair. Dr. Love, thank you for being here. I'd like a little bit more information about what we know about our currently hospitalized population. Wait just a moment.
Commissioner Neff, could you please repeat the question because I'm not sure what it was.
So a significant reason why this meeting's called While I'm Here is because I understand that our hospitalization numbers are being impacted. We heard from a registered nurse earlier today about some of the overtime that's been needed from our healthcare professionals who've been on the front line for over a year and a half now, and the strain it's put on our medical system. Could you speak a little bit to the population that's currently hospitalized within Clark County? What we know about them, demographics, also vaccination rates, any kind of patterns that we can tell from them.
Yeah, fortunately, with our hospitalization data and our death data are not as bad as we saw at the early stages of the pandemic. But nonetheless, we're still seeing upticks in our hospitalization rates. And we expect that the increase in deaths may follow as a result of that. But typically, your hospitalization data is being driven by the folks who are elderly and folks that have underlying health problems that will predispose them to getting sicker with those health problems and likely end up in the hospital for that care.
To Commissioner Jones's point about, I certainly believe I've been vaccinated, was glad to get it. I believe in the science behind it. Could you maybe help us understand a little bit better? Obviously, it's my understanding that those who are hospitalized are disproportionately those who have not been vaccinated. Is that true?
Yeah, that's correct. Our data, both here in Southern Nevada and across the country, indicate that the vast majority of people that are showing up in hospitals with COVID are the unvaccinated.
We also heard today that the masks are a Band-Aid. That's actually a comment I kind of agree with. I've used that expression myself. They are a Band-Aid. I believe that the vaccine is a permanent solution to helping us move forward. We've also heard a lot about closures. I think another significant reason why we're here today is to prevent any type of closure. We've all seen it. We all have families who work outside of government, and we've all seen the impact of that and never want to see that again. What are those solutions to prevent any type of nightmare scenario returning to the state that we were last year?
Yeah, so to prevent what we had to do last year, obviously the most important thing is to increase our vaccination rates in our community, because we know that this vaccine is very safe. Despite what you heard today, it's very effective. And as you can see by our hospitalization data that I just mentioned before, the folks that are ending up in the hospital with COVID are folks that are unvaccinated. We're only seeing a very small percent of people who are hospitalized with COVID who actually have been vaccinated. So that right there suggests to you that the vaccine is very effective at both preventing hospitalization and of course, at preventing death. So vaccine is our most important tool. We need to continue to make vaccine available to folks in the community. We need to do what we can to try to promote vaccination, and we need to do what we can to make sure folks are properly educated and know the risk and the benefits of this vaccination. So again, vaccine is the most important thing that we can do. Apart from that, a myriad of other mitigation strategies, from wearing masks, social distancing, washing hands, covering your cough and sneeze, all very effective collectively in terms of being able to prevent the transmission of this virus.
Thank you. Chair, I suspect I'll probably have more questions, but I'll pass the microphone for the moment.
Okay. Anyone else have any questions? Commissioner Miller.
Can you give us a little bit more detail as to which public health risk metrics you use when looking at the data that's out there, that you based your recommendation that we re-implement a mask policy?
Well, I think what we're seeing right now, what we've been seeing in the last six weeks is two things. We're seeing a dramatic increase in the number of cases in the community. Again, almost a fourfold increase in cases since early June. And we're also seeing a huge increase in the percent of tests that are positive for COVID. So those two factors really suggest that we're seeing an upsurge in COVID transmission in our community. And what is likely to happen as a result of that is we're going to see a proportionate increase in hospitalization rates and a proportionate increase in mortality as well. So I think those two metrics alone are really made us decide that we really needed to do something to help try to mitigate the transmission of this virus. And more importantly is with this Delta variant, it's now about 80% of all the cases in Southern Nevada are due to the Delta variant, and the Delta variant, as you've seen on TV, is a much more highly transmissible virus, which means that once it's in the community, we're going to see more and more infections, and obviously our data is showing that.
When you look at those risk factors, are there certain milestones that the health district has determined in advance to say if we reach this point, we're going to get to the point where we're going to have to recommend again that that the public wear masks?
Well, I think in some ways we're already at that point. We're seeing a large increase in cases, a large increase in test positivity. We're concerned that that's going to lead to increase in hospitalizations and increase in deaths. And I think we really need to go back to our toolbox. We need to figure out exactly what we can do to try to mitigate that. And one solution, of course, is wearing masks. It not only protects ourselves from being exposed to it, but more importantly, it helps prevent the transmission of the virus onto others in the community.
And more specifically, I think as I've looked at what other jurisdictions are doing, certainly I think we've done a very aggressive effort on public outreach and trying to convey the importance of vaccinations. But some jurisdictions like Washoe County have definitive standards, it appears, that they've put in place where they create a level of risk monitoring the daily case counts and the hospitalization rates, and provide clear direction to the public to say if we reach this milestone, we may have to recommend masks. If we reach this milestone, we may have to consider some of the measures that I think would bring more consequences, including reducing occupancy or potentially even a shutdown. Right. So it's made clear to the public that if we're not taking action and we're not seeing the vaccination numbers at the rate we want, that these are the consequences. What are we doing in that regard to try to communicate that to the public in advance so that they can see the trajectory of where this may go?
Yeah, so that's a great question. We haven't actually gotten to that point yet in terms of identifying specific metrics in terms of where we might escalate our actions, but that's something certainly I can bring back to our team at the health district, and we can consider that.
But if the case counts and the hospitalization rate continue to surge, is it foreseeable at some point that you would potentially recommend a reduction in capacity for venues or other more serious measures?
Yeah, again, I think it's kind of premature for me to say that right now. I think I'd have to go back to our folks at the health district, consult with them, and come up with a plan based on all the information that we know.
We had approved the county mitigation plan. We had an entire section that dealt with large gatherings and public venues, specifically stadiums and those types of events. Some of those recommendations had criteria by which we wouldn't be allowed to open at full capacity until we reach vaccination rates. Are we still looking at any of those kind of metrics? And what is the recommendation from the health district with respect to those large gatherings?
Yeah, again, we haven't had those discussions yet. I think as we saw these increases in case counts and positivity rates, we made a determination that we needed to do something that was simple but also very effective, that wasn't going to be a huge burden on our society. But I think depending on how we perceive this trajectory to go, if it's going to get worse or better, then obviously we need to begin to consider other mitigation strategies as well. But again, I think it's kind of premature for me to talk about those here.
Sure. And where is that trajectory? Does the health district kind of have any analysis at this point as to where we believe this ultimate case count may go?
Yeah, again, I can't really speculate on that, but with any epidemic or pandemic like this, we're going to see ebb and flows of cases. We're going to see low case counts, we're going to see peaks, and then we're going to go down to see valleys. So it's really hard to know how long these high case counts are going to continue, whether or not they're going to level off in a few weeks or whether or not they're going to increase. It's really hard to say. But again, your suggestions are good ones, and I can bring those back to our team at the health district, and we can consider those and figure out if we need to do anything more than just the mask recommendation going forward.
Some of the specific industries that were called out in the press release, as I understand, were related to specific data that we had associated with outbreaks or infection rates within those industries. Right. Can you describe a little bit more about how we're tracking that and associating those infections and where these recommendations came from?
Right. So what you're referring to is the data that we track on potential places of exposure. So for any time a case is identified and reported to us, we do an investigation on that person. We identify where they might have been in the last few days prior to the onset of illness. And we basically tabulate that data and we determine where the so-called hotspots were. So obviously the airport, casinos, large stores, those tend to come up more frequently than other places, in part because that's where more people are. So it's not surprising for us to see that we see large numbers of people reporting being at the airport or at a large event. So it's not the best data. It just gives us some indication of where people have been and where their likely sources of exposures are, but it doesn't necessarily let us know that that's where people actually got exposed.
Okay, but the recommendation to wear masks is based on that data, in the belief that this is where the infections are occurring. So if we encourage people to wear masks in those places, that would prevent the spread?
That's correct.
Okay.
The basic idea here, of course, is that the more people we have in one gathering, the longer they are in that gathering, the closer they're exposed to other people, there's just an increased chance of a transmission of the virus if, in fact, one or more people are infected.
What is the health district's recommendation with respect to masks? I know in the press release it was listed as a recommendation. Do you have a position as to what action this board should take as to whether or not it should be a recommendation or whether or not it should be mandated? Given now that we've had several days to look at the response and see whether or not this is a significant enough buy-in based on recommendation alone?
Yeah, that's a great question. I guess I would kind of look to the board to make the best decisions they can based on what we know about what's currently happening and based on the data that we're seeing here in the community. My job as a doctor in public health is to try to do whatever I can to protect the public from these diseases. And we know that masks are effective. We know that mask mandates are effective in making sure that people are wearing them. So based on those two things, I would recommend that that this mask mandate be implemented if the board so chooses to do that.
And is there any sense at this point as to whether or not a comprehensive mask mandate would be more effective, or is it in fact needed, given the concerns about the disruptions and the like, or would mandating this to employees alone be sufficient at this point?
Well, certainly I think you could look at it if you want to do incremental steps, and perhaps just doing the mandate for employees might be a good solution. If you wanted to be much more aggressive, then a wider mask mandate might obviously be more effective in terms of being able to prevent the transmission of the virus. But either way, I think either one of those two measures, I think, will be effective in terms of being able to mitigate the transmission of this virus.
But we're here today because this is an emergency that quickly arose, right? And the Delta variant is posing significant public safety concerns, and really required to impose some type of measures in order to try to mitigate it. Given how quickly this is rapidly developing, I hear you to say that we could impose potentially some mandate today, but that wouldn't prevent us from getting feedback and direction from you and the other members of the staff that would tell us that that now is the point where we may need to take on additional restrictions.
That's correct.
Okay.
Commissioner Sager-Blum, and then I want to chime in on the multi-agency group, so go ahead.
So I think you've got to answer this, but just to verify, I've heard this described as a pandemic of the unvaccinated.
A lot of folks, including the CDC director, have made reference to that. That's correct.
And what about having employers require employees to be vaccinated?
I think that presents a challenge, at least currently. I think the consensus is until the FDA actually gives full approval to the vaccine, then we can't make a mandate for vaccination at this time. Once the FDA fully approves these vaccines, then it's going to be a different story.
But as far as you know, employers have the right to insist their employees are vaccinated.
I believe so. I mean, there's been some efforts certainly within healthcare systems around the country to mandate vaccinations, and my limited knowledge of those situations indicate that those held up in a court of law. But and we do mandated vaccinations for children in school as well. So there is a possibility for that.
Excuse me, stop. Excuse me, stop. Dr. Loff, would you please finish your question? Commissioner Sager-Blum.
I was just asking about, mandating it as far as employers requiring it. That would be their option. But at the end of the day, what we need to do is we need to get this community vaccinated. Is that really, that's the ultimate solution, right?
The ultimate solution, getting the community vaccinated, that's correct.
Thank you.
Okay, Commissioner McCurdy.
Thank you, Madam Chair, and thank you, Dr. Law, for coming to present and sharing the information that you've been able to garner over the last year or so, with all of us equally sharing in the brunt of what happened in all of our lives during this pandemic. And what we've noticed is that, went from a point to where we didn't know anything about this virus. Then we got the information from all the healthcare experts. They provided their insight from their position. That was pushed down to the states so that we can be more aware. And now we're at a point to where we've experienced being locked down, opening back up. We see our economy coming back. We see more business, opening up. We see more people starting to come visit Las Vegas. And what we're ultimately trying to do from where I sit is try to prevent us from ever going back to that place to where we were completely locked down, not being able to move, not being able to do business. And, unfortunately, this is just one of the things that we all have to agree to do to mitigate the spread of this new Delta variant so that we can gain more knowledge about what we're experiencing. So we've listened to a lot of testimony this afternoon about antibodies and how if you have antibodies and you've had COVID in the past, you may not need to get the vaccine. It will be helpful for you to state clearly from where you sit, based on your knowledge, why someone who have even had the virus in the past and may have antibodies today should still get that vaccine and also go with the recommendations that the health district has set forward. Can you please clearly lay that out so that the people not only here in the audience but also those who are watching can understand from your expertise why we should still consider getting the vaccine?
Yeah, so certainly as people get a natural infection with the COVID virus, your body does develop an immune response to that. And that immune response may vary according to the person and their level of infection. And it may go away in a short time. It may persist for a long period of time. At this point, we don't really actually completely understand what the long-term immune response is to a natural infection with COVID. We just don't have enough experience with this particular virus to really answer that question. But we do have a lot of really good data about the effectiveness of the vaccine and the effectiveness of that immune response, the effectiveness of that vaccine's immune response being able to prevent infection with that COVID virus. So that's why we recommend that all people, regardless of whether or not they had a past infection with COVID or not, get the vaccine.
Thank you for that. So can you also lay out, where we are currently with the breakdown of age demographics of the percentage of folks from those age demographics who are vaccinated? Can you lay that out, break it down, have people 65 and older, and give us a little bit of a understanding and a breakdown of where we are right now.
Yeah, so the simplest way to provide the breakdown of vaccination by age group is to say this, that the older folks who first had access to this vaccine back in January and February have the highest vaccination rates in the country, and of course here in Southern Nevada. Whereas the younger folks who had the least amount of time to get vaccinated have had the lowest vaccination rates. And I think part of this data is also driven by the fact that older folks likely fear that they're more at risk for severe complications and death from this virus, which is why they want to get the vaccination, whereas the younger age group think oppositely. They feel that even though they may get exposed to the virus and get infected, that they're not going to come down with any complications. And that certainly may be true, but we also have to recognize that this is not just a disease of individuals, this is a disease of population. So vaccinations not only protect you from getting the virus, but it also, and more importantly in some cases, prevent you from transmitting the virus onto other people. So I think if we look at this from a community-based perspective, we have to understand that vaccinations are very effective in not only protecting yourselves, but more importantly, protecting your family and the community more broadly. The same can be said about the masks.
So in your estimation, based off the facts that we have now and based off what we've gone through, we need to put our mask back on so that we can continue to at least operate in the manner that we are right now, correct?
Yes, I would agree with your statement. I mean, had we not got this resurgence in cases that are being driven by the Delta virus, I don't think we'd be having this discussion here. But now that we're seeing this resurgence in cases, again, being driven largely by this very highly transmissible Delta variant, I think we really need to do something that's very simple and very effective to try to mitigate the further transmission of this virus and try to deal with this pandemic that's occurring here in Las Vegas.
And as you continue to evaluate the data based upon your new recommendations as of last Friday, you should definitely think about rolling out a plan to us so that we can at least have a benchmark to know, like, hey, this is where we are. We do know where we're trying to get in terms of vaccinations. But, as we've seen, we had the Resort Association come up, and support, having the people put on masks because they also understand the need to make sure that not only are we protecting employees, but we're also protecting our local community as well as our tourists. So if we can have something provided to us so that we can have just a little bit more predictability, I think that we will be able to, communicate out to the general public as to where we are, where we're trying to go, and what we're going to need to have happen in order for us to continue to stay open.
Yeah, we can certainly do that, yes.
Okay, and Commissioner Gibson, I just wanted to put a couple of things out because Dr. Loff is great, and I know that we kind of threw you into this because Dr. Lagon is in a different spot, and we've been meeting with Dr. Lagon for a while. I sit on the Health District Board, So the state does have the metrics that we can get to the whole board. The state has been here this week, right? And we are working with FEMA to just get out and give people information on where they can get vaccinated or tested at this point, because many people are looking for testing as well. So Commissioner Jones, honestly, I don't know what DM is. I just learned TikTok, so I don't know any of the other acronyms, but if you tell me what they are, I will help get Jennifer Sizemore, who is the PIO for the health district, to see if we can get some of those things out as well. So we can, as a health district, get them the information that needed, because we have all those metrics and we know where we're trying to get to at some point. And I don't think that anybody up here, including the health district, wants to shut down anything, because that was hard for everybody. So we're trying to figure out what are some things that we can do the short term to slow it down so that we can maintain our hospitals. Commissioner Gibson.
Thank you, Madam Chair. Dr. Loeb, are you aware that there have been at least one agency, and maybe others, are actually pulling samples of sewer water in an effort to determine whether or not there's some evidence of infection in the sewage? Are you aware of that?
I'm aware of that.
Are you aware of what it is they're looking for? I mean, is it antibodies? Is it something else, some constituent of an antibody? What is it they're looking for?
So the idea behind what's called the wastewater surveillance is that.
Would you speak up just a little more loudly into that microphone?
I'm sorry. It's a wastewater surveillance program wherein researchers are collecting samples of wastewater and looking for concentrations of the COVID virus within wastewater, which of course come from our feces and sewage.
Waste.
And waste, exactly. So they're able to and they collect these samples over time. They measure the concentrations of the viruses. They're able to also look at the different variants in the wastewater as well. And that kind of helps us give us a really early indication of what might be happening in the community in terms of increases in cases. And in fact, a few weeks ago, we saw increases in concentrations of the COVID virus that preceded some of these surges in the cases in humans.
So you're essentially saying that we've been able to document that there is a correlation between the test results and what happens in the real world once the time has passed. Right. So help us understand a little bit about timing. We pull samples, we run them, we determine that there is evidence of the illness of COVID in samples that have been drawn around the valley, and it's happening in all the cities all across the valley. What might you expect in terms of the passage of time before you actually begin to see positive cases, sick people? I mean, obviously, some of the people who were at home or elsewhere are already sick. But what kind of lead? You said a few minutes ago that we saw a spike in the results from the testing of the sewer, followed by what period of time before we began to see the effect in the community?
Well, if you look at the natural history of infection, so you get infected, the virus reproduces in your body. That virus is excreted in your GI system. That in turn ends up in the sewage system. They do the sampling, and at that point in time, they're able to identify the relative concentrations of that virus at that point in time. But then you have to skip ahead several days, if not weeks, before you start seeing people coming down with symptoms, and then start seeing people getting tested and start seeing increases in the test positivity rate. So the long and short of it is that this wastewater surveillance is a really good key metric or indicator, if you will, of what's happening in the community before we can actually identify cases because of delay between when people start to get sick to when they actually present to a hospital to get tested.
So on the 4th of July, the weekend of the 4th of July, we had a whole lot of people who were in close proximity with one another, celebrating, partying, doing whatever the people do, having fun on the 4th over the weekend. And when would you, as a public health expert, expect to begin to see effects from that? Is it 5 days? Is it a week? Is it somewhere between 3 and 10 days? You know, give us a sense of the way that you take the data and use it to predict what might be happening in the community.
Well, I would say within the wastewater data, I would suspect to see increases or spikes in that within 5 to 7 days, which is when people's levels of virus begin to increase. And at that point, people may start to get symptomatic. And once they get symptomatic, within a few days, they might go to their healthcare provider because they're not feeling well. And then at that point, they get a test. And then, of course, there's some delays in terms of when a person is tested to when that's reported to us. So that could be another 24 to 48 hours. So that's the general trajectory, if you will, of how these infections kind of play out.
So a week ago, Garth Brooks, Bruno Mars, a big fight, all happened here in Las Vegas. Just kind of off the top, it sounds to me like maybe 100,000 people were in attendance indoors at a series of events, and the rooms were packed.
Right.
So we might expect, say, a week out from that, so this coming weekend,
right,
we may begin to see some effect from those activities. Is that essentially what you're saying?
That is correct. Yeah.
Now, when you start looking at the infections that we have, there's been some testimony offered today that the vaccines are not effective. They're not perfect. People still get COVID. And we've seen in this valley some what we call breakthrough infections. Is that correct?
That's correct. And
do you have a sense of the percentage of breakthrough infections that have been recorded?
Well, we do monitor for so-called breakthrough infections, which are infections that occur after someone is fully vaccinated. But we don't have a good sense of the overall scope of reinfections within the community because we're not able to really study identify every breakthrough infection, if you will.
So in other words, some people may be asymptomatic, but they still may be infected.
Correct.
After
Right.
a vaccine.
Again, the important point here is that no vaccine is 100% effective, but I think the important thing to know about this particular vaccine is that it's protecting people from getting severely ill, it's protecting people from having to go to the hospital, and it's protecting people from dying. So those are very good objectives and very good outcomes of using a vaccine.
Now, we received a recommendation from you, and it went to the public in the form of a press release. In it, correct me if I'm wrong, the recommendation was masking indoors, not outdoors.
Correct.
Is that true?
That's correct.
And while the answer may be obvious, let me just ask why.
Well, indoors, of course, you have very enclosed spaces. Air circulation is not as good as it is outdoors, and we know that this is a virus that can travel through the air. So if you're in a confined space with poor air circulation, especially in situations where you are around a number of other people, your risk of acquiring or transmitting the virus is so much greater than if you're outdoors where you have a open space. And the virus is not as, and you have more opportunity also to be spread from one person to another. So it just doesn't transmit as well outdoors as it does in an indoor setting.
So you've recommended only indoor masking.
Correct.
Is that correct?
Yeah.
And let's say that we were to adopt some mask requirement.
Mm-hmm.
I think I heard you say earlier that if we were to do an employees only requirement for masking. It would pertain to those who were indoors or those employees who go indoors. So when they're indoors, they would be required to wear a mask.
Correct.
And when you look at the recommendation that you've made, what about people who work in an office by themselves or in a cubicle, even though there may be other employees in the area? Are offices or cubicles areas where you would feel comfortable that folks could take their masks off and work?
Yeah, in fact, that's a new recommendation at the health district that we've implemented as of yesterday. So if any of our employees are in a public space within our building, meaning that they have an opportunity to be around other employees or members of the public, then we require that to wear a mask. If they're in their office or in their cubicle, then we do not require that mask to be worn.
You have not recommended anything at all about closures, have you?
We have not.
And we're not, in fact, I don't recall a time when the Southern Nevada Health District made some public, issued some public statement that we should close one thing or another. Am I right about that?
You're correct.
So there's never been a time in Southern Nevada where you recommended to us, and I can say we acted upon a recommendation to close anything. There's never been a time when we did that.
That's correct. All those mandates came down from the state.
Okay. So our objective here is to try and save lives, is to try and prevent infections, is to try and keep an economy moving that is at risk if our numbers get high enough that people get worried and they stop coming here.
That's right.
Do you have a sense of and I'm guessing we probably do not have, but do we have a sense of the comparison between folks who are infected that are visitors as opposed to folks that are infected who are residents of the community? And I ask that question because I know you can test the sewage in the resort corridor and where there are predominance of hotel rooms and likely more people who are from outside the community than inside the community. And is there anything in any of those test results that suggests something like that to us? Lots of infection, in where there are lots of hotels, not so much in another area. Anything like that? Have you seen any kind of a correlation like that?
I'm not as clear about those data, but my understanding from what I do know is that we're not seeing those kinds of correlations.
Okay. I think for now, Madam Chair, those are the questions that I have.
Okay. Anybody else have any questions? So, Dr. Lopp, I know that because I sit on the health district and because we have the multi-agency group that meets and the emergency managers meet on a regular basis, I'm super in the weeds in it, and I'm trying not to do that for all of the constituents that are here today because they did take the time to come out. But there are some myths out there that I think that we got to start breaking down regardless. So one of them is if you're fully vaccinated and you get COVID and you test negative, you do not have to quarantine anymore, correct?
That's correct.
And so I think that for us, we need to really, as a community, start educating people on some of those actions so they know how to navigate through the system, right? There's a lot of anxiety. Everybody can go on to the Southern Nevada Health District. Those numbers, we publish them every single day so that we are transparent, so that people see where we're headed. We've had many conversations from June when we were, singing the praises that we were at 3.9, 3.9, 3.9, and then 5 days later we were at 5.9. So, and so we're not naive that the transmission, and we started out with, I feel like 8 folks that had the Delta variant. and then it became more prevalent than what we had before within a couple days. So it's for us, our responsibility for public health. We have to pay attention to it, right? So, and we're not the only ones. So across the world, everybody's paying attention. We're getting calls from around the country. What are we doing? I just attended a National Association of County meetings last weekend, and everybody's experienced this. And we know that at some point, there's always going to be a level of it within our community, but a manageable level, so that we can make sure that our hospitals don't get into a situation. And for me, we did get into a situation where it was tight in the winter time. It was tight for us, right? Our hospitals can go up to 125% occupancy. We were teetering at 110, 115% occupancy, and then add on that we couldn't even find enough nurses to come and work. So we were in that situation. I think that we've, in the county, have done a great job in the health district of trying to manage all of the expectations. So, and all the partners that have come together. So, for instance, the sewer report exists because we sit on the Water Authority and we asked for it, and Commissioner Gibson brought it to the table very early, right? We have tons of calls with many different agencies, and this week that is why the state epidemiologists and other folks are here. And I just feel like somehow, and we're a great community. I've lived here my whole life, but we got to get back on track to get out of this. Honestly, let's get over it, right? I think that's the new hashtag that people want, because we want to move on, but we're not in that spot today. And I do think that we do have to do something at the very least to protect our employees across the valley, because they're bearing the brunt of all of this. And you can go onto the Southern Nevada Health District website, and you can see all of the potential locations, the occupations that people are doing. And it's not just one area, it's throughout the valley. You can go on the website, and I feel like we were like one of the first counties to do that across the country, because we wanted to be transparent with folks, right? So we know 89052 is a hot zip code. We know 89148 is a hot zip code. 89147, 108. I know them by heart. 030, right? So we've made lots of progress with making sure that people had accessibility to get vaccinated. So, and there are always going to be those folks that don't want to, but the majority of the folks just need to be educated, and we got to do our part. So to Commissioner Jones's part, we need to learn these new avenues that they're looking at to give them the proper information. We need to, we need everybody to put it everywhere. You know what I mean? So here's the truth, or here's what we believe, you decide, right? But it can't be any more of people assuming and making assumptions. And it's a passionate issue no matter what. It's hard to be in this spot. It's a little bit easier for you because you get to just tell us the recommendations, but people don't want to hear from, they don't want us making decisions, but we're following your lead as the doctor, because you are the expert. And I know that epidemiologists and the health district, which is our hidden gem, is really, all of those folks been working very hard to communicate, collaborate with all of that information. So I'm just hopeful that we can do something a little bit smaller to get back on track, to really educate people, and to figure out what folks are willing to do to support it. So your thoughts or not? It's been a long day.
So are you asking us for our thoughts now as opposed to questioning this witness?
Unless anybody has any more questions. I mean, I was trying to be mindful of everybody else's, so I'm curious.
Yeah. Madam Chair, would you indulge me for one more question? I appreciate it.
No, I'm glad to bring it up. So go ahead, Commissioner Miller, and then, excuse me, stop. Commissioner Miller?
You know, After the release of the recommendation, this is a question that I got, and I think it's maybe not well understood, and so I'd like to try to tee it up. I think that everyone understands that wearing masks at work all day can be uncomfortable. Certainly, if there's a public health mandate to do it to protect the public and prevent more drastic measures from being implemented, people are willing to do that, including an endorsement from a resort association saying that if we mandate mask policy, that they're in support of that for employees. Obviously, there are a number of employees, though, that got vaccinated, believing that a benefit of doing that would be that they don't have to wear a mask. So we use that as a carrot in order to encourage vaccination for some time.
Right.
And now the policy, because we're here in this place, at least one of the recommendations is that we now mandate it for employees whether or not they're vaccinated or unvaccinated. At many of those resorts, though, unlike when you're walking around in the public and you don't have the ability to verify whether or not somebody's vaccinated or unvaccinated, they actually have programs where they verify whether or not people have vaccinations, and they wear badges that indicate that they've verified it. In the employment context, they're actually able to know that 80% of our employees, and here's the 20% that for whatever reason have chosen not to get vaccinated.
Mm-hmm.
What's the public health benefit to mandating in that context where we have verified that they're vaccinated, to requiring everyone to wear masks across the board?
Well, I think the simple answer is that it's just easier to require everybody to wear a mask regardless of the vaccination status, because we don't always know if people are doing what they need to do. So if I was a vaccinated person and walk around without a mask, then that's one thing. But it's hard to know if a person is unvaccinated. It's hard to know just by let me step back. So folks who are walking around without masks on, it's hard to know if they're actually vaccinated or not, because some people may choose not to wear the mask because they feel they've been vaccinated. Others may choose not to wear the mask even if they're not vaccinated. So it's just an easier tool, if you will, to just require everybody to wear the mask than it is for just that subset of folks that have been vaccinated.
Okay, I understand that. So, and part of the other justifications that I've heard are that there is some belief that if employees in facilities, including casinos, are not wearing masks, then the public's not going to wear them either. And that by encouraging employees to wear them across the board, it's going to encourage in public settings that they also abide by the public health recommendation, even though it isn't a mandate at this point, to wear masks, because the public will understand that there's a real risk that this Delta variant is high risk and is spreading at a rate that it could be absolutely devastating to our community. Is that part of the explanation?
You're exactly right. I mean, the employees set example for their customers. They're wearing a mask, so it creates some expectation that perhaps the customers should be wearing the mask as well.
And another explanation that I heard, which I understand that maybe we don't have a lot of medical science behind this yet, but we know that breakthrough cases exist. And in those breakthrough cases, people are much less likely to suffer severe symptoms, including hospitalization. Yep. But they will potentially exhibit symptoms and could potentially transmit it to other unvaccinated people, even at very high rates. Is that also correct, that we could have unmasked employees that contracted through a breakthrough case the Delta variant and then spread it to unvaccinated people, which would also have a devastating impact on the community?
Yeah, again, another reason why we ask people who are vaccinated to wear masks as well, because there is, again, vaccines are not 100% effective. They do a great job at preventing severe disease, hospitalizations, and death, but we also know that they can, people who are vaccinated can still get infected and exhibit symptoms or exhibit no symptoms at all. So those folks wearing a mask helps to prevent the spread of the virus to other people if in fact they do get infected.
You have Commissioner Gibson and then Commissioner Naft.
I'm sorry, Madam Chair. I just forgot to turn it off.
So Commissioner Naft.
Thank you, Madam Chair. Dr. Loaf, my questions are actually for senior management. If you just want to, I don't know if you want to rest your feet for a moment, you're welcome to. You've been standing for a long time. If you'd like to sit for a moment. Okay. I'd like to speak a little bit. It was mentioned several times throughout this meeting. Just moments ago, we heard from our partners in business, both the Resort Association and the Chamber of Commerce, what some private employers have been doing to encourage vaccinations. I think there's a lot of partners in our community that have really stepped up, have done a wonderful, tremendous job helping educate their team members and helping to further our goal of increased vaccinations throughout our community in the effort to stay open and protect each other. Could we, Madam Chair, if it's appropriate, have a conversation about what the county has, Manager King, 10,000 employees. We all serve on other boards such as LVCVA, RTC, Metro, Fiscal Affairs, and we have 38 departments. What are we doing to encourage our employees? Is there further direction that this body should give to help further that goal?
So, Commissioner, we have early on, we're offering vaccinations to all of our employees, and then most recently, we had some on-site vaccination clinics to further encourage those who did not originally get their vaccinations on the first round of vaccines, that we also wanted to be able to offer that again in case we had employees that actually changed their minds. So every so often, I encourage our employees to be safe, to vaccinate. I believe as public servants, it is our responsibility to, we're here to serve the public, and it's our responsibility to be the example to our community. So I do encourage employees to continue to be that example, because we are public servants and we're here to serve the public. And it's our responsibility, I believe, that we do provide that example for the community.
Thank you. I agree. I think we ought to be leading the way and certainly taking cue from some of in the private who've done a good job and striving to improve on that here within the county. Maybe I could request a manager information report to the board on ideas of how we can further that goal and maybe things that we've not yet tried, but looking to our partners in private business who've been successful increasing their vaccination rate, putting together those ideas that would work within the county and our partner agencies.
Yes, we can absolutely do that for you.
Thank you.
Okay.
If I could just follow up on that, let's make sure the union's included in that.
The who?
Make sure the union's included.
Yep.
In the conversation?
Thank you, Commissioner Segerblum. Yeah, our bargaining unit should be a part of that.
Okay, anyone else?
If we're asking for comments, I would go forward and say we need to start considering mandating our employees. If you aren't willing to get vaccinated, then you shouldn't be coming to work. And I saw something about the hospital. The hospital, UMC Hospital, had like a third of their employees were vaccinated. That's unacceptable.
Excuse me. Okay, so anybody else have any questions, anything for our senior management team? So here's what I would, excuse me, we are in deliberation. So here's, I think at some point we'll need to make a motion one way or another. I think that, Ms. King, is that enough direction for just our employees, or what are you looking?
That's enough direction. We will coordinate with the unions and gather their ideas as to how we can encourage our employees to vaccinate. Think of some additional ideas, and then we'll bring those back to you for your consideration.
Okay, the Clark County Commission will take a 10-minute recess. Okay, we're going to go ahead and call back to order our Board of County Commission meeting. So commissioners, where were we discussing potential moving forward?
Madam Chair,
Commissioner Gibson?
Madam Chair, there might be another piece of direction that we could give to staff, and it would be related to the things that we've heard here today in the context of social media. I would think it appropriate to secure the services of an expert, someone who really knows how to do peer-to-peer and other kind of communication. I mean, what we have to do is we have to make sure that the communication is thoroughly provided. And if there is some way that the persuasion occurs because there is more of an exchange of information, we are all better off for that. I think that's a piece of direction that is a worthwhile thing to do.
So that's additional direction for staff. Okay, so now the hard question is, what do we do with the recommendation that the health district put out and what will we'd like to see across the valley going forward? I know, at least for myself, I'd like to see a plan from those entities that were listed under the recommendation on what they are doing for their employees to keep them safe, to offer options for the employees. I'm worried about our employees. We are getting lots of calls around the country to know if trade conventions are going to be safe to come here and if our employees are going to be safe. So I guess I'm looking for some thoughts and some direction from the commissioners.
Well, Madam Chair.
Commissioner Gibson.
Thank you. Just a couple of thoughts. I mean, first, instinctively, my first thought was, what had ever happened to personal accountability? We have had all these options. We've done everything we can do to serve up the ability for any individual to take advantage of both the testing and the vaccinating. But what has moved me to a different place is that I know of cases that have been delayed in their treatment or their procedure at hospitals because our hospitals are now in a crisis. And we owe it to the public not to permit that condition to persist. Secondly, we have already been through a shutdown and a startup, and we cannot afford to have major conventions decide to go elsewhere. All of us have the freedom to make the choices we make. We make them. We don't jail people who don't get the vaccine. We don't jail people who are unwilling to be tested. We encourage them. We do what we can to educate them according to the things that we understand. But at the end of the day, there is a reality, and the major shows who come to Las Vegas and provide the midweek occupancy that really sustains this economy are now questioning what we're doing because of what they're seeing. It is highly published, and the world knows what's happening in Las Vegas. I think that for my part, what moves me away from if you catch it, it's on you, and the personal accountability for choice, I'm not going to remove the choice. They still have the choice. But I've moved from do nothing to we have to do something because we can't afford to allow hospitals to become even more worse in terms of their crowding. And we cannot afford to have this economy suffer, not even in the slightest. And that will happen for sure. So I guess my sense is that the employee piece, masking employees who are in publicly accessible space is a beginning. I don't know if it's the end because I don't know. I just think about what's it going to take to blunt the increase in the infection rate. I don't know. But if the health district is telling us that is something that a part of what they recommend, then I think we need to do that. We're going to be responsible. We're going to be accountable for what more would have happened had we not done that. And they are the experts that we must rely on. And so my sense is that we need to take action to mask employees in public spaces during their workday. Now, I will tell you one thing that is kind of out there. People are saying, well, you know, I got my vaccine. So you're saying that I don't get any benefit of that? When I'm at work, I got to be wearing a mask all the time. And my response to that is we can't control people. We have to act based upon what we're able to do in an environment where people do have the freedom to make their choices. We can tell employers to do what they must do if they're licensees of this county or licensees of any of the other jurisdictions under the order of the governor or the directive of the governor. So at this point, I get it. We're not doing anything about children in school. We've never had any jurisdiction over the schools. If the truth were known, our chair and each of us worked awfully hard to get things back open, frankly, before anything happened that really started opening things again. We have always been very concerned. We have our own children and grandchildren who are in the schools. We have seen the failure associated with our capacity to do distance learning effectively. We can't tolerate that again. We don't want to see that again. But we don't have any jurisdiction over the school district. We have no authority, no power. And it is obvious from the things that we have seen in the past that we have no influence no matter what we do. They have paid no heed to what we've urged upon them, and they'll do whatever they're going to do. So I think under the circumstances, we take action to do what we have heard our public expert, our public health expert advise us. And then I think that the word has to go out that we are hoping and expecting that will blunt the increasing rate of positivity. But if that doesn't work, we still have hospitals that are getting more and more overloaded, and we have the risk that there will be a real reaction in the economy given what the industry that we rely very heavily upon is going to do. And we've heard in the last couple of days that our agency of record has received some serious questions about what we're doing from the trade show and convention industry. The Las Vegas Convention and Visitors Authority has told us they have received direct questions from some of, including the largest of our conventions, wanting to know what we're doing to try and blunt the growth in the positivity rate. Commissioner Naft and I are on the LVCVA board, and we are aware of those inquiries. So I think if we're not able to slow this, and this is, you know, people will cooperate or they won't, but we're all going to suffer. If we don't do something that slows this down and turns the corner, then we're going to be back here again. There is probably a train of thought that suggests what rational people would do is just take and cut off the whole tail right now and mask the whole world right now. But there's a reality out there. In order to do this in an orderly way, we have to give everyone an opportunity to plan for it, to organize themselves. We would need to meet with them. We would need to meet with trade show managers, convention managers, and producers. We would have to organize ourselves in a way that was effective. We cannot do something that just creates chaos. And because there is this difference of opinion in this society, there's probably going to be a fair amount of chaos anyway. We've seen a bit of it today. So my sense is that we need to move forward. We need to require plans of those that were listed. We need to follow the recommendation of the Southern Nevada Health District. And we need to make sure that we give assurances to those who would submit plans that the confidentiality of the things they submit to us will be preserved and guarded because the requests we're making pertain to activities on the gaming floors, for instance, where we have absolutely no authority. We have no jurisdiction at all. But anything that is ever submitted to the Gaming Control Board is confidential as a matter of law. So the things we do, we have to make sure that we are not causing a breakdown in the processes and in the legal framework that we're supposed to be, or that they are supposed to be operating in. So frankly, I'm prepared to make a motion.
Okay, go ahead, and then we'll see if there's any other discussion.
Okay. I therefore move to follow the recommendation of the Southern Nevada Health District insofar as those who would be required to wear masks would be those who are employees when they are indoors in public spaces. That the large employers, the hospitality industry employers who have been on calls with us and who have the capacity to prepare plans that would help us understand what they're doing to protect employees and, for that matter, the visiting public, because it becomes a critical element of the decision-making processes of those who come here, that they be required to submit a plan. I don't know what a fair timing for receiving those plans would be, but I would think that it's in everyone's interest that it happen within the next few days. And so unless we would receive some information that suggests it's just not doable by the close of their business Friday, they could submit it electronically and it should be submitted to the business license department. That would be my recommendation as to the plans. And then when it comes to the events that are occurring, I think we have to be open to what might happen there. So in the end, what we've got to do is we've got to get together and we've got to determine if there is more. But we can't just spring it on people because there are plans, there are activities already underway, and it wouldn't be fair. We're not trying to just take advantage of people. So my motion would be that. Now, I don't know what I've left out. There is language that would need to be included in this motion that pertains to the confidentiality because we want to make sure it's enforceable to the extent we can.
That's correct, Commissioner, and staff will put together that sheet to inform businesses, and it'll include a promise of confidentiality on that sheet to encourage compliance.
Okay, Commissioner McCurdy first.
Can we also stipulate what the timeline of this is going to be so that everyone can have predictability as to the time frame that they're going to be asked to be compliant with what we are going to essentially recommend today?
Do you have a time frame you'd like it to be considered?
Well, the health district, in their recommendation, I believe it was August 15th. And that puts us well after the timeline in which school starts. So I guess between now and August 15th, if we can have the public come together, and this is not going to be easy, but this should be easy. We should take this time to literally come together over the next few weeks to evaluate how we are doing in terms of wearing our mask, mitigating the spread of this new variant, and also making sure that we have predictability available for not only the general public, but as well as our business owners as well. So I would recommend the health district's recommendation of the August 15th timeline.
What if we extended it to 2 days later? I think we have a meeting 2 days later, do we not? And yes, that is something that is publicly noticed. It gathers a great deal of attention. People are aware of our schedule. Would that be all right?
That sounds perfect.
August 17th?
It would be the 17th, I think.
Okay, any other?
What about the effective date? When would we say this motion and the resultant order would become effective? Any thoughts on that?
So let me ask Commissioner Jones if he has anything, and then Commissioner McCurdy.
About the effective date, or
whatever you have to say.
Okay. All right. So I don't have a problem with this concept of moving forward today with requiring employees to be masked, but I won't pretend that I think that it's going to have much of an effect either on transmission of the virus or on trade shows or others, asking questions as to whether we're taking meaningful action. So I think that this has to be paired with an ask, or at least a requirement, that businesses be posting signage that makes it clear that the Southern Nevada Health District has requested that all people within indoor spaces wear masks, not just employees. And more so than that, we've talked about vaccination, and that's really what is going to change the trajectory of where we are. And so if the headline from this meeting is that we imposed a mandate on employees, then we will have failed. We need to get people vaccinated, and we need to take meaningful action. I understand we don't have a recommendation here today, but we need to take meaningful action to get to that 70% at least in short order. And I think we need to have recommendations back to us on what actions we can take well before August 17th. So I think my recommendation would be that we have some sort of information or recommendations coming back from the health district, from the county, as early as next week on what we can do. I mean, we had a presentation from the health district before, and one of those requests was for the hiring of a media firm for a marketing campaign, and that was more of a long-term thing, but I don't know why we wouldn't be doing that like tomorrow in order to make sure that we're getting where we need to be. So again, if the headline is just that we imposed a mask mandate on employees, then we failed. I hope that we have real consideration real quick about addressing the real issue, which is vaccination rate.
Okay, Commissioner Sigerblum, do we have a health district meeting this week? Because we could maybe, it'll be under an action item, so maybe we could at least implore the county commission's wish just to get that marketing thing. Or do we have it this week or next? Do you know? I don't know.
The health district is Thursday.
Thursday? Okay, so we'll take that message for you, Commissioner. And also, I believe that the health district does have some signage template that they put up earlier on the website. I do think that business, and I do think it says something to the effect that COVID is high in our community. Please, we ask that you wear your mask, whether you're vaccinated or not vaccinated, but I'd have to look at it again. Did you find it on the website? But we'd probably need businesses at least until Friday morning to get the signage together. Okay, you looked that up. Commissioner McCurdy, what was you were going to add something?
August 17th will be the date that we would come back and have another conversation about it. And we would have an opportunity to review just how we did within these short few weeks of immediate mitigation of the spread of the virus. And I believe it would be appropriate to, start the effective date being tomorrow midnight. That would allow for some predictability as well as for an opportunity for those who still need time to get signage and so on, if the rest of the body would agree with that.
Okay, Commissioner Sigerblum.
So we don't have control over the hotels, though, right? So are we going to ask the Gaming Control Board to adopt what we're proposing for the hotels?
Well, I think the gaming board has made it clear that they'll follow the lead of the commission. The problem is that this is not an item that is a typical, health district goes to the gaming control board and then they go off. That's not the way it works typically.
I'm just saying, but hopefully they're listening then, because obviously the hotels are a major part of this whole thing we're going to propose. But the other thing is, as Justin said, I think the end of the day, it's vaccines. And I think we need to redouble what we've been trying to do. Like we had the Spanish language group, we let that die. I mean, that's criminal to my opinion. We got to pump that thing back up. Mia Familia Vota's out there going door to door. I mean, that ends the end of this month. I mean, we can let's give them $1 million and say, let's get back out going door to door. I mean, whatever it takes, we need to let the community know that we are urging people to vaccinate and give employers notice that we hope they will make it mandatory on their employees or encourage their employees, starting with us, with our employees, as we talked about earlier. So, I mean, I think this is an urgent matter that we just need to let the public know we think it's urgent, and everybody, we're going to take the lead as opposed to just say, oh, we hope this happens.
Okay, and Commissioner, we can bring that up to the health district. The county was paying for it for a little over a year, but the health district has received their dollars. So we can bring that up Thursday, you and I, on immediately getting that process in place for marketing. I believe they can expend it pretty quick if we light a fire under them.
Yeah, but again, this is a fire. I mean, and I think there's no reason we can't have, organize some kind of a committee or informal group of hotels and chamber and business and government to sit down daily and look at the numbers from the sewage, look at the vaccination rates, look at the positivity rates, and I don't know if we can wait till August 17th to just sit around and hope something happens. I think we ought to be more proactive in that personally.
Well, if I might, I'm not suggesting that we sit around. What I'm suggesting is that we got to do something. We do it now. What we can do, we can organize ourselves so that whatever the next action or the next step is that we take, all of the affected people have had opportunity to plan, to implement what we come up with. So that means there's going to have to be a lot of discussion among ourselves, as you're suggesting, Commissioner, between now and August 17th. The one thing I would say is I would like to have our staff search for the kind of consulting that I mentioned a moment ago, that is the kind of thing that Commissioner Jones is referring to. Because if we wait, then when will it start? We've got to be working the social media, we've got to be working the rest of the media. We have to get the persuasive conversation going at the earliest possible moment. So the health district, I think it's great that the health district is going to go work on that and do that. I think we should be working on it, then we can confer with them. All of that comes together. But we all are doing it.
So let me do a couple things that I think will be helpful. So Eric is in the audience. He actually chairs the JIG, which is the Joint Information. So maybe he could stand that up tomorrow and start having those conversations. And maybe Commissioner Jones, you can sit on those calls. And it is all of the region, everybody across the region, right, Eric? And you can push for some type of newer, younger stuff, as well as what are we doing. And I do believe that the state is also on that call. And, as I said today, did I say it earlier today, that FEMA is out doing door hangers. The young leadership folks of the chamber, they came up with a new slogan as well. So maybe you could spearhead that for me and make sure that everybody's on track and pushing that. So we can direct staff to make that happen. Commissioner Sager-Bloom and I can bring it up at the health district as well. And then don't forget, we do have those regional multi-agency communication meetings where we have a bunch of folks on. So we've been meeting every 2 weeks. I'm happy to make those every couple days if necessary to get us back on track to talk about what we could further do. And I will also send you all the reports that are posted on the health district so that you can see it does post how many positives, how many were in the hospital. It does post a lot of information every Thursday. It updates on demographics, and so we can stay on top of that. So I'll be happy to do that for you. Anybody else have any questions or comments? And then I want to try and circle your motion back. Commissioner Miller?
In support of Commissioner Gibson's motion, and for many of the comments about the consequences of not doing something, worth also pointing out that the White House has issued a report where Nevada was #1 in many of the negative indicators in terms of infection rates and a lot of other categories. In addition to conventions now having concerns about what action we're taking and whether or not that's going to be sufficient, we now have major jurisdictions that are imposing potential travel restrictions or travel advisories about coming to Las Vegas. Apart from the public health concern, which should obviously be our primary consideration, there is a very serious economic consideration to the measures that we take here. I'm receptive to Commissioner Jones's comments about whether or not we're doing enough today. But we're here in an emergency setting, I think operating as quickly as we can because the Delta variant spreads so quickly. This is perhaps the easiest measure that we can take that's in line with the voluntary recommendation that the health district recommended, because we can move very quickly with requiring employees to wear masks, I believe. As we potentially would take next steps and requiring it in public, it would obviously get a lot more complicated. We'd have to issue definitive guidelines as to where that would apply. I think we should start working on that today. As I mentioned before, I'd like to see us move towards some kind of metric that they're using in Washoe County or other jurisdictions where they have categories of risk assessment to say today we're at moderate risk, so tomorrow we may be at high risk, and then very high. And the public understands what those metrics are based off of and are able to look and understands the consequence of if we don't do something today. This is why we're taking this action. If we don't see improvement, we could move to the next highest level of the risk assessment, and if that's the case, the health district's going to have to come and recommend to the board that they take even more severe measures. We don't want to move towards reduction in capacity or face the consequences of other jurisdictions imposing restrictions on Las Vegas and see our economy shut down. So, the public should have a very clear understanding that if they're not getting vaccinated, if they're not wearing masks, even though it's voluntary now, if they're out in grocery stores and the places that the health district has identified, if the public is not abiding by those voluntary recommendations, this will have consequences. And the more that we can outline that in very clear terms that say if these numbers reach this peak, this is where we're going to go. And the public's going to have to wear masks. We could potentially have to consider reduction in occupancy. I think the more that we can do and have that discussion, it will benefit this dialogue to try to drive the change that we need. I'm supportive of Commissioner McCurdy's suggestion that we revisit this potentially on August 17th. But I think this issue is significant enough that every time we meet, it should almost be a regular item on the agenda that we have a quick presentation. This is the biggest public health crisis, the most important issue that's in our community. We keep a daily tab on it and really talk about the measures that we're taking and try to broadcast that as much as we can so that the public clearly understands the consequences of not taking the right action.
Okay, understood. And I will also, Ms. King, I don't see Chief Steinbach. Maybe we could have what day is today? Tuesday? Maybe we could have a regional meeting on Thursday to get everybody across the board. I know we have zoning tomorrow and some folks have some town halls, so maybe we could have another regional meeting on Thursday. And we can see if Dr. Lagon will be available. And then we can get you that additional information, Commissioner Miller. So let me see if I got this right. So Commissioner Gibson is making a motion that all employees that work indoors in a public space wear a mask, that 2 plans be submitted for so Commissioner, I just want some clarity on this one. So initially in the health district recommendations, it was casinos, grocery stores, malls, those type of venues. We need to be super clear. Is it all gaming licensees, both non-restricted and restricted, so that we're hearing from everybody? Or what's your thoughts? And I had talked to Dr. Lagon about that because it's an easy word for him, but we don't want to leave out some of those other venues with large employees just because of the wording.
Well, I think that the recommendation the entire text of the recommendation from the health district needs to be a part of the motion as a preamble to the motion. I think that way we've got that in front of us. And then the recommendation was, I think, that the non-restricted licensees, but that would be what I think we do. I think you get past that, you're now talking about thousands of licensees. I don't know how on earth we manage that. We're going to do the best we can. We expect them to be in compliance. But the plans that probably matter the most are the ones where there are thousands of rooms and massive casinos and enormous pools where there is all kinds of day and night life and other kinds of things that are happening in those properties. I think that is the group that was, in my mind, was intended to make present a plan.
Okay, I just know that. Okay, and it's a start, right? At the end of the day.
Yeah, we're talking here about doing something.
Right.
Getting going. I mean, we have been told by our medical advisors, whom we have reposed a great deal of trust in, that we have a medical crisis. So, yeah, there is probably a more perfect way to address things, but you don't let the crisis just linger for a while till you come up with the perfect solution. So we've got to do something, and that's
Okay.
really what motivates me.
Okay. Commissioner McCarty, did you have anything?
Yeah,
else?
question of clarification. So for those who are watching, particularly, folks in, some of our other industries that may have nightlife, they would only have to submit one plan for the duration of, the different operations that they have on various weekends or days. Just one plan would be necessary, correct?
Correct. Just one plan initially. Tell us what they're doing, because I believe that the health district, and we did this, commissioners, we did this with testing early on. We kind of asked what people were doing so we could go out and target and work in collaboration with them, whether it was clinics, whether it was education, whatever they would do. But we need to see who's doing what so that we can help them along if they need it, or stay out of their way if they're doing great.
Got it. And also with this vote, this would also impact other municipalities, correct?
This is across the region, from Mesquite to Boulder City to Laughlin to everybody in between.
Yes, just want that clearly
It
stated.
probably bears mentioning, Madam Chair, that you have convened the Regional Policy Committee that includes the leadership of each of the jurisdictions and other public agencies, and have helped them understand what our options are. And what we're presenting here today is one of those options that we received unanimous support for. Is that a fact?
Yep. And that includes the higher ed. There's over 80 agencies that are included in that. So let me start this motion again. So just because I know that we want to make sure that it's super clear so that people know what the expectation is. So Commissioner Gibson has a motion to require all employees that work indoor in a public space to wear a mask.
Madam Chair, could I just make one comment on that?
Yeah.
So it's all employees, when they are in public indoor spaces, must be masked. If they're in their office or their cubicle, they don't need to be masked. But when they come into public spaces, they must mask. And if I'm misinterpreting something that the good doctor suggested to us, I want to make sure there's clarity on that.
Ms. King? No?
Well, I think for me, maybe simpler, maybe for the public.
I can't hear you.
So I just want to make sure I understand. So for what the board is suggesting is that employers across Clark County, which includes all of the cities, employers in all the cities, employers in unincorporated Clark County, will be required to have their employees, or there's a requirement for employees of all of those employers to wear masks in what we're calling public spaces. So if they are not in an office or an enclosed area, those employees will be required to wear masks.
Yes.
Okay, is that clear with everybody? Because that's a key piece of clarity for folks. Secondly was to require plans of the large employees, which included casinos, malls, and grocery stores. Is that correct?
Yes.
Okay, and those plans will be submitted to Clark County and they will be held confidential. Correct, Mary? Okay. And that there would be signage posted. Some already have signage, but the signage should be big enough so that people can see that if you are following the CDC guidance, it's one thing, right? So we recommend that they wear masks.
Yeah.
Okay, sorry. Oh, it's been a long day. Okay, so and then so the signage that you should have should be following the health district's guidance that we recommend that you wear a mask inside events. And I should have said on those plans, those are large venues, which is defined by the health district of 250, would also be required to submit the plans. And we only need them once, and they will go to Clark County. And so we will work with all the business licensees to put a form together so that they can submit it. Commissioner Gibson, I'm not sure. I'm happy to get it all done tonight, but maybe we could give them until Monday morning at 8 a.m. so that I could get the form out in a timely fashion to them tomorrow and get it emailed.
I think that we need to make sure it can be done. So I think giving them the weekend makes a lot of sense.
Okay. And that the mask requirement for employees would take effect at midnight tonight? Is that what I heard? Or
I think we heard tomorrow night.
Okay. Yeah. Tomorrow night? Okay.
So is there a conflict in requiring that their plan about what action we have just taken isn't due until Monday, but the action that we're acting upon takes effect tomorrow? I mean, is there a disconnect there, or are we okay doing that? Mary, what are your thoughts?
I don't think there's a disconnect because it's important to take action now, and the plan submitted will be for information to see if the actions are working.
Okay.
Okay, so then, so those would apply to both public and private.
Yes.
Okay, and then lastly, so the effective would be tomorrow at midnight, correct? And then it would end on August 17th, correct?
It would continue through August 17th. And who knows what's going to happen August 17th. So yeah, the 17th is the date this action would live to and through.
Okay, Commissioner Miller, did you have anything else? No. Anybody else have anything? Are we clear on the motion, Mary? Yep. Okay, there's a motion on the floor by Commissioner Gibson. Any further discussion? Seeing none, please cast your vote. Commissioner Sagerblum? Commissioner Sagerblum?
Oh, sorry. I hit the wrong button.
And that motion passes. Okay, this, Commissioner, Ms. King.
So, Madam Chair and Commissioners, this is that concludes your agenda for today for the emergency meeting, and you can move to the second comment section of the agenda.
Okay, this is the second time set aside for public comment. Anybody wishing to speak, please come forward and state and spell your name for the record. Good evening.
Hello, ma'am. Steve Gramis, president of the Las Vegas Police Protective Association. Thought my guys were coming to get me as I walked down here. That's GRAMMAS. Just for a little clarification, because, and hopefully you can offer me a little bit of more extra time, just because I need some clarification for my officer. So I know it was a recommendation of the Southern Nevada Health District, or not recommendation, but they said if people are already vaccinated, it's just easier to go with a blanket blanket mask rule in the workplace. And I understand what his position was. It's probably tough to get everybody dialed in. What I would ask is that at LVMPD, we keep a running list of our officers that are vaccinated, and those officers, some did it just so they didn't have to wear the mask. If the position is that if they are vaccinated, it's just easier, since LVMPD already has a manifest that describes who is and who isn't, I would ask under Robert's rule that somebody from the prevailing side, which is any of you, rescind the motion and go back and allow the people that have already tracked who's vaccinated to be able to make their decision based on who is vaccinated, who is not. We with our officers have a plan already. If they're unvaccinated and they're found without a mask, that they could be a part of discipline. So I would ask that somebody would do that for me, for one. Two, I would ask for our board to remember this is a collective bargaining state. We have a lot of people that collectively bargain. Statements like, if they don't like it, they don't have to come into work, or if people don't want to get a vaccine, they may not need to be here, probably are things that shouldn't be said. I know for my officers, we're probably under around the 40% vaccination rate. I would hate to make statements like that to officers and them take it so literally that maybe they don't want to continue in their profession. So I would just be very careful on statements we make about things like that from my perspective as a president for my officers. I would hope that somebody could make that rescinded motion and change it so that our people could still do work the way they need to. As I've instructed some or talked to some of you, when we talk to folks, there is a very big concern with communication. Having a mask on, trying to go through a high tense stress situation, pulling a weapon, possibly deadly force, use of force, conversation needs to be very clear. We don't want people to misunderstand what an officer is saying. With that, the folks that are already vaccinated, I'd like to see them keep without their masks and move on, and we'll continue to do what we can with the vaccination rollout as some people have talked. Thank you, guys.
Okay, thank you. Anyone else wishing to speak on public comment? Mr. Euling.
Yes, my name is Ed Euling. This is what I understand about Kabuki theater. You only ask selective questions, and then you have the result that you planned at the beginning. I didn't realize that Kabuki theater was a big deal here in Clark County. The questions that are being asked, you are constantly talking about metrics. You're not asking the questions. 689 people caught the disease on the 17th. Only one person died. That's like 0.00% of the population. And you're making this big deal. And what about the comorbidities of that person and the other people? It hardly ever goes over 1%. The big mistake that was made by our governor was back in April last year, when we realized that young people were not subjected to this disease, and he closed all the schools. Well, if the schools had stayed open, they would have developed.
Thank you, Miss. Thank you, Mr. Euling. Thank you. He was asking for a clarification, and he did not. He got 1 minute, 20 seconds. Mr. Euling, Mr. Euling, listen to me. He got 1 minute and 21 seconds, and I just gave you 1 minute and 21 seconds. So please, if you'd like to put one more sentence, I gave him 1 minute, and I watch the clock. I gave him 1 minute, 21 seconds. I gave you 1 minute, 21 seconds. So if you have one last sentence, I'm happy to let you have it. So one last sentence
is how the unions, public unions of this government really operate the government. You can't say bad things about them. It's the leaders of the public unions that are running the show here.
Thank you. Anyone else wishing to speak? And if you could just automatically set the clock to 1 minute, 20 seconds, so I could just tell you up front, we're going to do 1 minute, 21 seconds. Okay, go ahead, ma'am.
Good afternoon. My name is Kim Parker, Kimparker, and I wanted to say that this seemed terribly inauthentic, and you've totally negated any reference to proven therapies instead of just going with the mask route. And there are very well-known studies that have shown this, and I will reference Dr. Zelenko and Dr. McCullough, and this should have been talked about. Thank you.
Thank you. Next speaker, please.
Good afternoon again. I'm Blake Coral. For the record, once again, I'm Blake Coral Bayetti, CORL-B as in boy, AIETTI. One of the most concerning parts about this meeting was a public health official coming up in front of y'all, presenting claims such as vaccines are the most effective tool. We know masks work, along with other claims, and not any of you having any sense to have any kind of critical thinking as to questioning the veracity of those claims. Because I can tell you, again, I've read 45 plus publications on COVID. There is no evidence to substantiate those bold claims that he's making. And in science, one of the foundational principles, extraordinary claims require extraordinary evidence. And he did not provide that. Nor did any of you think to even ask about it to begin with. And when every single time the rationale as to the solutions that you're suggesting come back to, well, it's easiest. We're not here to do easy work. We're here to work. If you want someone to volunteer their time to do the work, I'm available. I'm only studying to get into medical school right now. I have time. I am here to do the work. It's why I moved back to this city and why I love it so much and why I'm speaking with the passion that I am. I love this city, and I mean this. I love everybody in this room. It's why I joined the military again. I'm here to do the work. Whatever kick in the ass we need to do the work, let's do it. Thank you.
Thank you. Anyone else that has not already spoken in the second portion of public comment wishing to speak, please come forward and state and spell your name for the record.
Hi, my name is Todd Koren, Koren. I own a local exhibit company in town, and few businesses were as impacted as we were during the shutdown. What Commissioner Gibson said earlier is so true. Every day I speak to exhibitors who are considering coming back to trade shows in town, and their biggest concern is it going to be safe? And if it's not, are you going to give us back our money? We need to keep people employed. We need to keep people working. We need to keep our tourists coming. We need to make them feel comfortable being here. The only thing I could say is thank you for the step with the masks. I just wonder, are we not thinking about the fact that we have always heard, you wear a mask to protect me, I wear a mask to protect you. We're going to have people wearing masks that are our employees, but what about protecting our employees from everybody else? That's my thoughts. Thank you.
Thank you. Anyone else wishing to speak during public comment? Seeing no one. I don't have anything else from the commissioners. Okay, this meeting, we are adjourned. We're adjourned.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.